Here we go. All right. Good morning, everybody. Welcome to our 5th MedPrep program. My name is Joanne Snap, and I'm really excited to be here with you all this morning. I'm going to introduce my colleague, and then we're going to talk a little bit about what we're going to be doing for the next year together. Doug, you want to come on screen? So Doug and I will be coordinating MedPrep this year. Doug is one of our staff advisors at HPA with me, and he's going to be handling all the logistics of the program this year and answering all of your questions in chat throughout each of the sessions. So Doug, you want to introduce yourself?
Hello, everybody. I'm Doug McLemore. I've been with HPA now for about a year. Come this way via, a former career in academia, then doing a lot of test prep and advising with Princeton Review, and now I'm here doing advising and focusing on test prep. So thank you for coming today, and I'll pass it back to Joanne.
Awesome. All right, so it looks like we have about 78 folks here this morning, and that's amazing. On our first day, we always get a big crowd, and I'm really excited that you all woke up at 9 a.m. on a Saturday morning to join us. So let me tell you a little bit about what we're going to do and what MedPrep is. I know we have first year through fourth years here. First years, I'm excited that you are so eager to get all this information in your head, and there's nothing wrong with you all being here and getting this information. I want to just stress to you, though, that much of the information that we're going to cover throughout the entire year in MedPrep is going to be way ahead of you. So, none of the things that we're going to talk about in terms of like building personal statements and asking for letters of rec and making your school list when we get further along, most of that stuff is stuff that you are not going to, I don't want you to even think about for another 2 to 3 years. So it's great that you want to know how it works and what, what you're going to be doing in 3 or 4 years, but I definitely don't want you to be doing any of this stuff. This is stuff that really you should be thinking about when you're getting ready to apply, when you're a year away from being ready to apply. So again, I want to welcome our first and second years, but I don't want you to feel overwhelmed or stressed as a result of learning this stuff, because it's definitely not where your head needs to be right now. Now, for my third and fourth years, this is totally where you are right now, right? You're either taking the Mcat this summer, or maybe even this January, and you are really close to applying. So MedPrep is what it sounds like. We're preparing your application. We're prepping your application for med school and for the Mcat. And so what we've done, if you look at the calendar for the year, is we're building the application process. So we're going to start today with some big picture ideas. Some of the stuff you might have heard from me already if you've heard me talk before. But we're going to keep adding on to it each time. So I'm not going to repeat myself at every session. You're going to get different information every time. And my expectation is that if you come to every session, you'll have a really well-rounded understanding of all of this. So once I tell you something, I'm going to build upon that in the next session. We'll talk about how to ask for letters of rec, how collecting letters of rec works with the application systems, and I'll show you some sample letters in terms of like how to ask for those with professors. We're going to talk about how to write your experiences, and I'll give you lots of examples of writing in terms of like what that looks like in your application. We'll talk about what it looks like in the applications in AMCAS and ACOMAS in terms of how you enter your experiences and things like that. In January, that's when we actually recommend you start writing your personal statement. We're going to go through how to do that. And so at that point, we'll expect that you have your personal statement drafted if you're applying this summer. And then we'll go on, we'll start building your med school list, which really isn't essential to do in February, but it's good to start thinking about it. We'll go over AMCAS completely. We'll go through all the fields, all the pages in AMCAS so you understand how that's going to work logistically. There's a lot to that. That's probably the most boring session because it's just a lot of information. And then we'll talk a little bit about how to prepare for secondaries and interviews. And that's as we wrap up the year. We finish out with a mock MMI, and then we do a practice MCAT. So, there's honestly a million things I could tell you about preparing for med school. And what I love about MedPrep is it does give me only an hour and a half, but it does seem from, this is our 5th year doing it, that I am able to cover quite a lot of content in that hour and a half once a month. I will stress, though, similar to every workshop that I run, I have a really long PowerPoint And I would say about half of the time, I don't make it through my PowerPoint. And that's perfectly okay, because what I really prefer is that if you have questions, that you raise your hand or you unmute yourself and you ask those questions while we're here. We're here on a Saturday morning. You have me for an hour and a half. So anything at all that you want to know about med school, preparing anything, definitely ask me. Now, if you're asking me, like, how do I write my personal statement in day one? I'm going to tell you, well, we're going to do that in January. I'm not going to go through the whole thing. But if you have quick questions, absolutely raise your hand and ask them, because I want to make sure that you don't leave our sessions with more questions. So without further ado, we are going to kick it off. And I want to start by just giving you my conceptual understanding of how to prepare for med school, because I think it's so important. I could literally read to you how SDN or Reddit or all the myths that perpetuate around campus, I could tell you what the checklist method to getting into med school would be. I'm sure most of you already know what that is, right? You need to do some research. You need to do some clinical experiences. There's some kind of hours you're supposed to count, which is bizarre. There's just things, right? All these things you have to do: community service, volunteering, all that. And then, you have to collect letters of rec, and they have to know you really well. They have to like talk about you personally, which doesn't happen too often. And then there's just so many myths that are out there. If you are operating in the med school process with that kind of false understanding about how the process works, then most of the time those folks end up falling through the cracks. They just don't get it. They don't get why we're doing any of this stuff. And so I want to start with the conceptual understanding first, so that when I go through all the pieces of the app, you understand why we're doing what we're doing, right? It's not just me making this stuff up. There's a reason why we're going to do the things we do. So let me tell you how I gained my information. I've been at Davis for 6 years, and our job, my job, all of our jobs and as pre-health advisors, is to understand what's going on in the admissions world. So we spend our free time when we're not advising students researching things, talking to professionals, asking questions, attending webinars. We kind of do that work for you, right? Like, we learn what it takes to get in so that we can translate that for you. So on some level, that's sort of like our expertise. However, prior to coming to Davis, I spent 4 years serving as the director of admissions at an allopathic med school, where I ran the screening process. I saw who screens applications when and why and how and all that. I ran the interview day, so I saw every single person who got invited to interview. I did all the admissions presentations. I ran them around and gave them tours around the med school. And then I sat in on every single admissions committee meeting for 4 years, and I listened to the doctors sit there and debate why and who got picked. And I will say that being a director of admissions at a medical school was a really powerful position, right? I got to wear a suit and heels, and I walk in and everybody stands up straight, and everybody, clung on to every word I said. And it definitely was powerful, and that was enjoyable, I guess. But what I didn't like about that job was that I never could really help anybody, because we had a political, it's the same thing at every med school. There's a political line we have to follow, which is we would always say, well, we take a holistic review to your application. We look at every single thing in your application. So someone will ask me a legit question. Should I do this or this? Or would this, is this going to help me, or would this, is this going to keep me out of med school or anything? I could never answer their question. I always had to say, well, we'll definitely take a holistic look at your application, and we'll take that into consideration. There was never a clear answer on anything. And that was, because of lawsuits and stuff. I literally couldn't answer any questions. And that's how med schools are. They're very protective, and they can't really give you any concrete information most of the time. And that part I didn't like. So I knew what it took to get into med school. I knew the decisions that they made. I knew why they picked certain people and why they didn't pick other people, but I could never tell an applicant that information. So when I left and I came to UC Davis, I did that deliberately. I looked for a job where I could take all that information I had in my head, and I wanted to help students. And that's what I've been doing for the past 6 years, and train the HPA staff on all of the information I have in my head. And so that's what this program is going to be. It's really breaking down conceptually the why and the how. Okay. First, I really need to make it clear to all of you that when I talk about medical school, I am not talking about allopathic medical school. So I mentioned to you that I worked at an allopathic med school. What letters, well, it says right here, so I can't even ask. So allopathic med school is an MD school, right? And I know that everyone comes into college and they want to go to MD schools. However, when I worked at the med school, we had DOs on our admissions committee. We had DOs on our faculty. We had DOs who were pathologists and OB-GYN and all different specialties, ER. And one of our faculty who won Faculty of the Year voted by the students was actually a DO at an allopathic, at an MD school. So this, this was in New York. And in New York, most of these professions, MD, DO, DPM, ND, people don't seem to notice the difference. Like I sat in a room and there were MDs and DOs sitting at the table having conversations about who we should pick. And there was absolutely no issue. There was no, I don't know what people think it's like, but there was no difference between MDs and DOs. They were all the same. They were all doctors. And then so that was my understanding, right? Conceptually, that was my understanding of the world. And then I came to California, and then my Davis students started telling me, no, there's a big difference. There's something there that's a different. And I'm like, really? Because when I worked at a med school, there was no difference. I never understood there to be a difference. And that was the real world, right? That was where I worked. And so that's been really challenging for me to get people to understand that there really isn't a difference between MD and DO other than the philosophical training that you get as a DO. And so if you're curious what that philosophical training is, it's essentially that it's mind, body, spirit. It's not just body. It's that your mental health and your emotional and your almost like your psyche, right? Some people will call it religion. I think spirit reduces, that's kind of reducing it if you call it religion. But there's something else to us that keeps us human. And we have to take all of that into consideration when we're treating people. We can't just treat people for their pathology. And so that's how DOs are trained, is they are trained to take all three of those things. And they typically will try to use other methods, less intrusive methods, before they jump right into things like pharmacy or intrusive procedures like endoscopies or stuff like that. So when I talk to people, most students I talk to actually naturally align with DO, but because they've been told by their families and other people who aren't in the medical field that DO is less than MD, they just typically won't consider it. However, most of our applicants, by the time they're done with this program and talking to me and learning things, they actually apply to both MD and DO at the same time. I would say the vast majority of our applicants apply MD and DO in the same cycle. That is absolutely acceptable. We encourage you to do that, because many people who don't get into MD in the first try, they would be happy to go to DO after they spent, $6,000 and they've done this process for an entire year. They really just want to go to med school. After an entire year of applying, most people are happy to go to DO school because it's better than doing it all over again. So I would encourage you to just explore that and look into it, talk to DOs, research if you haven't already. But I think it's a very strategic move to become a doctor. So whether you become an MD, if you become an MD, of course, we're going to assume most of you want to stay in the United States to go to med school, but there are many offshore med schools, and we can talk about that if you have any questions about that later. That will get you the white coat, right? You get a DO, you get a white coat, you get to do all the same things. And then these fields down here, Dpm Podiatric Medicine, is same thing. Podiatric physicians get to cut people, they do surgery, they get to poke people, they get to write prescriptions. You get to do all the same things, only you have a limited scope of practice, similar to like a cardiologist or a primary care physician. You just know what your scope of practice is when you go into medical school. So podiatric physicians work on the lower extremities. So they typically work with diabetics, because diabetics often, diabetes usually manifests in the feet. Neuropathy happens, and then we see wounds and things like that. So podiatrists usually work with, they work with diabetics, they work with athletes. They can work with anybody though. They work with trauma, so you're gonna have DPMs in the ER. People shoot themselves in the foot, people step on nails, people break their ankles. All of that is a DPM. That they would go to the DPM for those things. And then a naturopath. I actually have a lot of students who also align with naturopathic medicine, but they're usually too ashamed to talk about it. A naturopath bills as a primary care physician in California. So what naturopaths do is they look for more natural approaches to healing. So they can technically write prescriptions, but they would usually look for other ways to treat something before writing a prescription. So naturopaths can specialize in mental health. They can specialize in, a lot of them do like weight loss or just general primary care. Some do diabetic care, but they're really looking at like food as medicine, and other approaches to healing. And I'm sure that many of you know people in your lives who would prefer to use natural approaches to healing rather than taking pills. I've met a lot of students whose grandparents use natural healing techniques in their kitchen. They'll make soups and other things, and they use those things to heal. They believe in the power of certain herbs and certain things to heal their body. So that's what a naturopath does. And like I said, they're a primary care physician. They bill through insurance. And so that's another route to be able to heal people and wear the white coat and be a doctor. So I just wanted to share that with all of you because, again, I think a lot of people assume that we're always going to talk about MD, but I want to let you know that you have other options too. You always have other options when it comes to becoming a doctor and wearing that white coat. All right, so this is, I assume, why this is what most people want to talk about, though. We're gonna assume most of you want to go to MD and DO, and you want to know what the secret to getting in is because it's super competitive and all of that. So we'll get through that. Some of you have probably seen this chart before many times, but if you have not, I want to just take a moment and talk about this because I think this is really, really important when we talk about how do you express the value that you bring to healthcare. So every single applicant who I sit down with as an applicant, when they get to that point, I will ask them the question, what is the value that you bring to medicine? And that is how I can figure out whether someone is ready to apply to medical school or not. I can look at their GPA and Mcat, but that's not, I mean, that doesn't take me too long, and that's not really indicative of whether they can get into med school. Numbers do not tell me a thing about whether you can get into med school or not, period. Like, I don't care what your numbers are. You could tell me you have a 399 and a 520 Mcat, and I still cannot tell you that you're going to get into med school. Every year we have people with those numbers who don't get in. So there's something else that med schools are looking for besides numbers, and people need to understand the value that they bring besides their numbers. So looking at this chart, this is actually a chart that I stole from the AAMC. This is a chart that they use to explain what holistic review looks like to their admissions committees. And this is what med schools are looking for or measuring. I wouldn't say they're looking for them in the sense of like they're checking off boxes, but they're looking at these things, right? And they're understanding who you are as a person and the value that you bring to medicine through this lens. So looking at this chart, is there anything on this chart that either surprises you or that you think like doesn't belong there, that they really shouldn't be looking at that, or yeah, anything like that, anything that you're not sure what it means? Feel free to post it in the chat or you can unmute yourself. Okay, so CJ says faith seems odd to be on there. Okay, well let's kind of test that one a little bit. Are there any faiths? Is there any circumstance where faith impacts what happens in an exam room? Can anyone think of an example where faith might impact what happens in an exam room? Anyone? This is a great opportunity for you to unmute yourself and chime in.
I think in more serious discussions, dealing with, women reproductive rights, possibly, your faith can hopefully not influence, a medical advice, but it could be something to think about, or how you view life, I guess.
Oh, okay. So you're talking about the doctor who doesn't believe in, you're talking about, I assume, abortion, and you're saying that shouldn't influence it. Well, actually, everybody is mandated by the laws in their state. So a doctor doesn't get to express their personal beliefs unless the state laws allow them to do so. So if you're working in a state, you have to, no doctor actually has the ability to do what they want anyway. They have to do what the hospital policies are and what the laws mandate. So in that regard, I'm not necessarily, I don't think that's really the issue. I don't think that's what they're thinking about when they are thinking about faith in terms of who they're picking for med school. I mean, lots of Catholic people get into med school. I don't think that's an issue. But let's think about other faiths besides that issue. Are there any other issues? Are there any other times where someone's faith affects their their healthcare?
Certain religions, like, or people who follow a certain faith, don't prefer to leave medicine as like their last resort when they know it's like they can't leave it up to whoever they're praised to, like God or so on and so forth.
Yeah, so some people believe in God's will and they would rather let things happen as they should, or as they would, I suppose. What about maybe certain faiths where women can only be touched by other women, or males can only be seen by males? A story I experienced, something that really taught me something, was when I worked in New York City. I once went up to a Jewish man, and like I do with everybody, I reached out my hand to shake his hand, and he pulled his hand. He didn't have his hand out to begin with, but he kind of stepped back and he was like, "Oh, I'm sorry, I can't shake your hand." Well, he didn't tell me why he couldn't shake my hand. I was just like, at first, I didn't understand that, right? Like I had just moved to New York City, so I didn't have that understanding. And so I kind of, had a moment of offense where I was like, oh, you can't shake my hand. Is it because I'm a woman? What's the issue? Well, then I realized, I learned, well, Jewish men can't touch other women besides their wives. That makes perfect sense when I understood that. So there was no reason to take offense to that, right? Like, it's just his religion, it's his faith. But if I were a physician and I had no idea that, let's say, a Muslim woman who was coming into the hospital really needs to be seen by another woman, and I had no idea about that because I haven't come into contact with any colleagues who are Muslim, or I just didn't know that. Could you imagine the issue that might occur in a hospital setting? Can you imagine the discomfort for the patient and the potential communication issues that might occur when a patient declines care simply because of the physician's gender? There's a lot of potential conflict there, right? So we need physicians in the workforce who represent a lot of different backgrounds, so that yes, we need to educate each other. That's how, diversity is a great tool for education. And also, let's just say there is a patient who comes in of a particular faith, and that physician happens to work there. They would have a much better cultural understanding of that patient and might be able to help in that situation, help navigate that complicated situation. So like all things, representation matters. We need people of all faiths in medicine, just like we need people of all sexual orientations in medicine. It seems like the parallel is similar, right? Can anyone quickly tell me why we would need people of all sexual orientations in medicine?
Would it allow for more understanding, especially if you're like transgender, and what it would allow for more understanding and compassion of the patient, for the patient?
Yeah, absolutely. Patients who come from the LGBTQIA community often receive biased care. They often do not receive the same quality care. They often are asked inappropriate questions, and they don't typically have a very pleasant healthcare experience. And so, again, same problem. We have disparities in certain populations, and we need representation in the medical field so that they can connect with those patients. I think we could do this for just about all of these, right? Like, you're starting to understand there's value that you bring to medicine based on the attributes and the perspectives that you have. Now, do you have to be LGBTQIA to want to serve the community well? Can you be an ally to the community? Can you spend time researching and understanding the community so that when you do have an LGBTQIA patient, you can treat them appropriately? So you don't necessarily have to have that identity in order to be an ally, in order to say in your application, this is the value that I bring to medicine. This is who I care about. These are the patients I want to serve. So the value that you bring certainly comes from some of the attributes that you naturally possess. For example, you can't control your race or ethnicity. You may not be able to control your sexual orientation. You might not be able to control your faith if that's what you've been raised in, and that's what you choose to do. But there are some things that, you know, when you share that, it translates into a tremendous amount of help that you can give to the healthcare field. And then there are other things like, you know, cultural humility. Who can tell me what cultural humility is?
Being understanding of other people's cultures and not relating it to your own, and setting your own cultural expectations on other people.
Yeah, so it's kind of like making assumptions, right? Like cultural humility, when we have cultural competence suggests some degree of knowing. So you say like, oh, I'm culturally competent. I already know. Well, that has a lot of potential for harm, right? If you assume you know somebody already based on either the color of their skin or your assumption about the way that they look, you can make some pretty big mistakes and assumptions about that person's belief systems. So instead of saying, I already know, oh, I had an Indian roommate, I already know Indian culture, which makes no sense, right? You would say, oh, actually, I don't know. Oh, can you tell me about yourself? Can you tell me more about your background? I've never heard of that religion. Can you describe that for me? What's your staple foods in your culture? So you do cupping. I've never heard it. I mean, I'm not familiar with that. Can you tell me more about that? How does that help you? How do you believe that helps you? So I think reducing cultural humility to an open mind is, I think, too simplistic. I think that it's really an interest and eagerness to understand other people so that you can provide culturally appropriate care. Now, I would encourage all of you to adopt the phrase cultural humility in your language and in your writing opposed to cultural competence, because it shows something else about you. It's something a little bit more bigger and better. So kind of going back, I saw a couple people put that they had a question about distance traveled. Distance traveled is how far or how your journey looked arriving at success. So once you arrive at the med school application, you've arrived at success, you got to that point, you're ready to apply, but was your path there a straight line, or was your path there a little curvy, a little bumpy? Did you have to do a lot of things to get to that point? Did you have obstacles in your way? Obstacles might look like coming from a single parent household, growing up low income, growing up in a community where there wasn't a lot of, there weren't safe neighborhoods. Maybe you had to take care of your siblings at a really young age. Maybe you had to start working at a young age and you worked through 4 years of college. So there are certain things that sometimes happen in our lives, or some situations we're born into, that make getting to the point of applying a little bit more tricky than other people who might have had that path pretty much paved for them. Now, if your path was paved for you and you didn't have any obstacles in life, that doesn't put you at a disadvantage. Actually, statistically speaking, you're more likely to get into med school because that's just who typically gets into med school more often. But if you had challenges in your life, if your distance traveled was longer, they want to know that. They want to know, what was going on, what happened, what were the challenges, because all of that stuff says a lot more about you. It shares other things about you, and we're going to talk about the competencies in a few minutes. So any other things on here that you think are worth mentioning, or you have questions about? Cultural world events, I've seen so many of those shape people. When the war started in Syria and all of those people went into Europe, I had a student who was studying abroad in Germany at the time, and she said that she was just traveling across Germany like no big deal. She had no idea what was going to happen to her, but she ended up on a train full of Syrian refugees, and they knew less German than she did, and they were totally lost and totally overwhelmed, and she ended up spending the rest of her time traveling, helping the Syrian refugees. That was unplanned. That was a world event that completely shook her, and before that, she had very little, I would say, experience working with people different from herself. But she ended up taking that opportunity to spend the time helping those people navigate the next step, getting into a camp and just figuring out what to do next. And she was, of course, she was an American in Germany, but just like I said, she just knew a little bit more German than they did, and so she was able to help them. That ended up being her intro in her personal statement. That ended up being like, that was a life-changing event for her. It changed her worldview completely, and she wrote about many things. She came back from studying abroad and ended up doing many other things that were guided by that one experience, by that one world event. So absolutely, like world events, cultural events, things that happen in our country. I've had students talk about how they were treated growing up after 9/11. All of that stuff, it impacts you. It shapes who you are. It shapes your worldview. And so those are things people talk about. All right, so let's go back to that distance travel thing. If you had a rocky background, what would they understand about you as a person as a result of having experienced some challenges in life? What are some qualities they would understand about you? Yeah, resilience, absolutely. That's it, just one? Okay. So you definitely can get better, you grow. All right, well, let me ask you a different question. Prior to today, what did you think med schools are measuring in you as an applicant? What do you think they're looking for?
I was thinking like maybe preparedness to like meet the rigors of the coursework.
Mm-hmm. So we'll call that science competency. What else would they be measuring in you?
The ability to thrive in high stress situations.
Okay. Like adaptability? Mm-hmm.
They don't want you to give up because that would look bad for them if there's a high dropout rate.
Oh, nobody drops out of med school. Oh, I shouldn't say nobody. Very, very few people drop out of med school. It's very, very hard to fail med school. Many people get through med school with C's. Like, it's very common to get C's in med school, which is why they changed their grading to pass, no pass to cover that up. But most people don't, like, they will make so many exceptions for you before they let you fail out. So that's not really a problem. Once you get in, it's very, very hard to not make it. All right, so none of you kind of took the bait and said what like 99% of other people say when I ask this question, probably because I put the answers up already. But what most people say when I say, what do you think med schools are looking for, is they say things like passion and empathy and compassion and that kind of stuff. And if you haven't already, and some of you know what these bullets are, I want you to spend some time Googling the AAMC 15 core competencies. That's what these things are. And if you Google them, you're going to find a page that has descriptions of what all of these mean. And a few years ago, when I was actually at the med school and I was going to the meetings that were designed for admissions folks, I remember when this was being put out, they were sending us surveys, they were asking, what they were trying to do, the AAMC, was standardize the qualities that they're looking for across all med schools, because it's so hit or miss. Some schools want, all the schools want different things. And right now, the push right now is to reduce the number of prereqs that are required for med school. So you're going to see that some med schools actually have no prereqs. They don't care about prereqs at all. And instead, they're using a competencies-based approach to admissions. If you haven't heard that phrase before, you'll hear it in your future. So they'll say, we're using a competencies-based approach to admissions. And when they say that, they're using the AAMC 15 core competencies. So what they did was they surveyed all the med schools. They said, what are you looking for in your applicants? And all the med schools filled it out. I shouldn't say all, that's too hyperbolic. Med schools filled it out. And this is what they came up with. So when we start to think about what do I need to do to get into med school? What is the secret, right? What should I be thinking about? Literally, they just gave us the answer. This is not a mystery. There is nothing we need to further consider about what med schools are looking for in us, because this is exactly what they're telling us they're measuring in us. So, service orientation. I hear so much that people tell me, oh, I got to do research to get into med school. Now, I think research is really, really important, but what I think is more important than research is community service. I actually know med schools that will screen people based on the number of community service hours. And so if you don't have a certain number of community service hours, then you won't be screened for that med school. There is obviously on here quantitative reasoning and scientific inquiry, which would fall under research. But if research is more important than community service, then why is community service on here? They're both on here. So it's not that, there's any type of weight here. There's not a degree to which one is better than the other. They're looking for all these different things. And so I just want to stress that if you are wondering, like, what do I do with my time right now, especially in COVID where I can't do research, do community service, because it's just as important in your application. Social skills. How could they possibly measure social skills in an application? If all they had to do was look at your pages, your words, how would they get social skills? Really simple answer. What do you think? No, not an interview. I'm talking about from the pages on your app, because you're trying to get the interviews, right?
Maybe
Once you get interviews, you're going to get into med school. That's not a problem. It's getting the interviews that's the problem. Yes, so a couple of you had it right. Clubs. When someone doesn't do any clubs in college, that's actually a red flag. So you need to do some kind of social club. Like, it can be a pre-health club, a pre-med club, but I would encourage you also to do something that you just enjoy, whether it be, intramural sports or crafting club or dance club or whatever. Do something that just shows that you have some ability to connect with people when it's not work related. Because when you go and you talk to patients, they're not going to be scientists. They're not going to be doctors. They're not going to be at the same level. They're just going to be regular people, and you need to be able to chit chat with them. So the ability to smile and laugh and talk to people, that's important. Yes, Lisa, sororities are fine. A lot of people tell me, again, these are these myths. Oh, well, I heard that I shouldn't put sorority on my application because there's some kind of negative thing about it. I'm thinking, okay, well, most of the doctors I worked with at the med school had children in college, and most of them were in sororities and fraternities. So I'm pretty sure that they don't care. And most of them were also probably in sororities and fraternities themselves, the doctors who are screening your apps. I don't think they care at all about that. What about being a RA? Yeah, absolutely. That's good stuff. Oh, you only see 14? Huh, did I mess something up there? I'm not sure. I copied and pasted, so maybe I missed something. All right, so teamwork, that's easy. You could do that through intramural sports. You could do that through working at a clinic. You can do that in a lot of ways. I don't find that teamwork is super hard to share. Oral communication. How many of you love public speaking? How many of you know that as a doctor, you're going to have to speak in front of teams or groups all the time? So if you're thinking to yourself, well, I'm not really good at public speaking, I hate talking in front of people, I'll figure out how to do that well later. That's going to be a problem, because eventually you're going to have to do that well. And so they're going to be looking for examples of how you can do that well now, and that's going to be found on your experiences page. So some of these things will be found in your letters of rec. Some of these things are going to be found in your personal statement, and some of them are going to be found in your experience writing. Things like capacity for improvement. I always encourage people to have their letter writers comment on their capacity for improvement. That means your ability to take direction and improve. Mm-hmm. You can also talk about that in your writing. You can talk about failing. And again, this is something where most people, when I talk about failure in a med school application, they kind of cringe, and they're like, why would I want to talk about failing in a med school application? Wouldn't I want to look perfect? Wouldn't I want to show them the best qualities? Anybody have any ideas why you would want to talk about failure in a med school application based on what you see in front of you?
Because failure is normal, and learning how to pick yourself back up after you fail is more important than the failure itself.
Absolutely. Like, people who are petrified of failing make me really nervous, because yes, everybody, if you're trying to convince me you've never failed at a single thing your entire life, I wonder how held up you've been in your life. It's impossible to not fail at anything. And if you've never failed, I wonder how you're going to experience failure for the first time at age 22 or 23. Because it's inevitable you're going to fail. At some point in life, a patient will die, you will mess up a communication, you will make a mistake, You will get really terrible feedback on something, and it's going to feel really bad. And I can tell you, having failed many times in life and made so many mistakes, that now when I mess up, I literally, like, it stings a tiny bit, but I'm like, okay, what can I do? What do I need to do moving forward? I don't get emotional about it. I don't let it affect me. I don't cry for 3 or 4 days. You just have to keep moving forward. And as a doctor, think about that. Let's imagine you realize you made a mistake on a lab, you misread something, you made a mistake, and so you have to really eat that up, right? You're gonna have to like feel that. You're gonna have to go in and tell the patient, sorry, I made a mistake. You don't have the time. You can't sit there and say, like, I'm gonna take the rest of the day off because I really feel bad about this. I really screwed up and now I feel bad. I'm gonna have to take the rest of the day off and go home and cry about it. No, you have to put on a smile and go into the next room immediately, 8 minutes later, and you're gonna have to do it again over and over. You don't have the time to feel bad about every time you make a mistake. So they actually like when people can talk about failing. It shows resiliency and adaptability. It shows that you have the capacity for improvement. It shows you can think through a problem. So I would argue that if you have examples of failure, and they're actually going to ask you that question directly on secondaries, they're going to say, tell me about a time you failed at something. I really have a hard time when people say, I can't answer this question. I've never failed. That's the wrong answer. You can't say you've never failed. So kind of going back to this is another chart that med schools use. This is probably the most outward facing one. They usually don't show that one I showed you because it's kind of controversial. But this one is what they will tell you about. They will say, well, we use the EMA. They use attributes instead of competencies. I change it to competencies. And this is basically saying we take a holistic approach to your application. And when people hear this phrase, I think the natural tendency is to think in their heads that, well, if I have less metrics, then I should have more experiences, or I should have, maybe I should get in because I'm a better person than the other 6,000 people who are applying, or I want this more than the other 6,000 people who are applying. There's something, right? There's some balance, but essentially it's almost always the metrics that are getting the short end of the stick. People usually will say, well, my GPA is lower, my Mcat is lower, so just because I'm such an amazing person, you should take me anyway. And I think that's a really bad misunderstanding of what holistic means. What this is saying, well, back in the good old days, before they were holistic, what they would do is they would take all the applicants and they would rank them based on MCAT and GPA. So they take, they draw a line at 200 people, they'd invite those people, and they'd bring them in. And so these are the people who had the top numbers, and they'd sit back and they'd, oh, you like basketball? I like basketball. Let's talk about basketball for half an hour. And then you're going to make a great doctor one day. And that's pretty much how people got into med school. It was based on their very high numbers and their ability to have a casual conversation with somebody. And as a result of them doing that for a few decades, we have a healthcare system now that are full of doctors who got into med school that way, who have very high numbers. But have any of you ever had an experience with healthcare that was less than ideal based on communication skills? Just one, huh? Oh, a couple of you. Interesting. So, yeah, me too. I've been hospitalized 4 times. I have some of the most horrendous stories about physicians. And this is from 3 different states. And I'm a white cisgendered female, and I can tell you I have had some of the worst experiences with doctors, like absolutely horrendous experiences with doctors. I don't think it matters what state you live in. I don't think it matters what color you are. I don't think it matters a lot. There are some really bad doctors out there. And that's the model that they use to get these doctors in there. Now, a few years ago, probably a decade ago, they started realizing that since America has some of the worst mortality rates in the world, and they're spending the most money in the world for healthcare, there's something not right about that, right? We're taking the smartest people, we spend the most money, and yet more people die in America than anywhere else. So, not anywhere else, but you know what I mean. So what's the problem? So they started looking at this further, and they realized, maybe numbers alone aren't the thing that's going to take. And so they started to say, now, we still need you to be smart because we still need you to get by in med school. You still have to take, you know, all these heavy science classes. And so there is some threshold. There is a bar at which we have to draw a line and say there's a bar at which we can't take below this. Does anybody know what that bar is for most med schools, where they won't screen an application below this number? What is that number? Yep, so you all have heard me talk before. Yep, so it's a 3.0. That's the bar at which they won't, most schools won't screen below that. Now, there are certain circumstances where they will look at your application, but do you want to apply to med school with the bare minimum though? Would that be strategic in a pool of 6,000 people to apply with the bare minimum? No. So they're saying holistically, yes, the bar is lower. We're going to look at people, you know, down to a 3.0 and a 500 Mcat. But it's not enough anymore. You can't just have good numbers. So this is why we see people who have 3.99 GPAs and who don't get into any med school. Any, period. They don't even get interviews sometimes. Why do they not get into any med schools even though they have a 3.99 and a 520 Mcat? What do you think is lacking? Well, in my experience, really smart people know, they've read enough Reddit and they've read enough SDN. They know that they need to do a lot of experiences. I actually don't find that really smart people fail to get experiences, but what they sometimes do is because they're using sort of like this formulaic process in life, they think they have to have all these things. They do what I call checklist experiences. Checklist experiences are, let me put it this way. You know you're a checklist applicant if you do the following things. What would look better to a med school? This or this? Or if you ask the question, what do med schools want to see? Now, if you ever find yourself asking questions like, what do med schools want to see? Or what would look better to a med school? This or this? Then you are falling into the checklist applicant category. And this is where I want to warn you. You need to stop doing that. If we go back to the chart, and we know that they're looking for the answer to what is the value that this person brings to healthcare, how can someone show the value that they bring to healthcare? How can we show them the answer to the who are you? How do you, like, on an application, like, how do you literally show them? Yes, I know competencies, your life experience, personal statement. Yeah, what are you going to write about in your personal statement? Yeah, I think I'm asking the question not the right way. So the things that you do with your time is how the world is going to understand you. So if I say, you know, if someone says to me, what looks better, being an EMT or a scribe? What do you think? Put in the chat. Is being an EMT or a scribe better? Okay, thank you. You guys get it. Well, you're absolutely right. They literally don't care which one you do. Why would they care if you're an EMT or a scribe? They have 6,000 applications. One is not better than the other, but let's explore what each of those say about you. So if you're an EMT, what attributes or skills might you attach to someone who is an EMT? What do I understand about someone who is an EMT? Yeah, so you work well under stress. You have to deal with stressful situations. Yeah, you have some degree of communication skills because you're going to pick up people off the streets, right? You're going to have people in uncomfortable situations. You have to make them feel more comfortable. You have to work on a team. You're never alone as an EMT. Yeah. Yeah, definitely. You're okay touching people. You're okay with blood. You're okay with all that. Okay, now let's shift gears. What do you understand about a scribe, for those who know what scribing is? Scribing is where you work in the ER and you follow the doctor around with this little rolly computer and you write down everything that happens between the doctor and the patient. Yeah, absolutely. You have to be a detail-oriented person. You have to be a really good listener. You have to know your medical terminology. Absolutely. You cannot mess up the medical notes. What would happen to the patient if you put the wrong thing in there? It's really dangerous, right? Patients can, if you write the wrong medication or the wrong anything, patients can get, mistreatment. Yeah, you're going to have a huge exposure to medicine. You're going to learn a lot. Now, one might say still, oh, well, that sounds a lot better. That sounds a lot better than being able to resuscitate someone and being able to, do a stent, whatever it's called. Someone breaks their wrist, being able to do those things. Is it really? I'm not sure if it's actually better. I think it's just different. It's different than being a hospice worker. So if you work as a hospice volunteer, you're going to be working with patients who are dying. You're going to be helping them in their homes. You're going to understand end of life care. You're going to really understand people intimately and what they experience as they're approaching death. Wouldn't that be valuable? Wouldn't that be really awesome, especially if there's certain fields of medicine you want to go into? So any of these experiences on this page these are all things people do to get into med school. I promise you, I swear to you, I can't emphasize this enough. Med schools do not care on any level what you do with your time. They literally don't care. If you ever ask a med school what they want to see, they're going to tell you there's two things that I think everybody needs to do. They need to show that you understand what you're getting yourself into. So what are you getting yourself into? You're getting yourself into a career where you're going to have to sacrifice much of your personal time for other people. You're going to miss holidays with your families. You're going to work nights. You're going to work overnight shifts. You're going to work weekends. You don't get to choose your schedule. You're going to stand on your feet for long periods of time. You're going to miss meals. You're going to experience a high degree of stress. You're going to be making decisions that affect people's lives. So that's what you're getting yourself into, right? So how could you possibly show them that you understand what you're getting yourself into? Well, first of all, you probably should have some experience talking to doctors. Now, does that have to be in shadowing experiences? Can you learn what doctors do by talking to them other than shadowing? Absolutely. You can just have informational interviews. You could do e-shadowing. You could do scribing where you see it firsthand. You could work as a transporter in a hospital. You could do all kinds of things where you understand what a hospital setting is like. And I would say, so the second thing I would say is all of you need to step foot at least one time in a hospital. I'm really, really bothered by people who apply to med school and who have never been in a hospital. You need to know what the environment is like. You need to know if you can deal with the smells and the sounds and the constant chaos and the lighting and all of that, right? You need to know that you are okay with needles and blood and crying and stress. If you thrive in that environment, you need to know that. And if you are not comfortable in that environment, you also need to know that. Now, whether what you do with that information, if you're not comfortable with it, is up to you. That's not my business, but I think it's important. I think they want to know that you know that. You've at least tested that.
Can I ask you a question?
Yeah.
So with like getting to talk to doctors, how would you put that into a application if it wasn't shadowing? And
it's called an informational interview. Especially in the day of COVID, I think they're going to be expecting to see a lot more of that. And typically, I mean, people could have done that the whole time, but of course, everybody would rather do things like shadowing. But you could do things like going to the pre-health conference and going to the physician workshops, and then you can list the conference and list the doctor's names and list the workshop topics and say, like, I really learned a lot about ophthalmology in this workshop. That shows that you explored the career by learning more about it from someone who does it. Okay. You could do that through club presentations. A lot of different entities right now are hosting things with doctors talking. And anytime you can find a doctor talking and you can go to it and learn, just hearing different perspectives from different doctors, I think is more valuable than just shadowing one doctor the whole time. So I'd say hear as many different doctors talk as you can at this point. Since shadowing is going to be, I would say, pretty impossible for a while, then try to get as much exposure. And you would just list it on your experiences page.
Okay, and then as far as like, I understand that like I mean, what's like a time, what's a duration that would show like competency and like understanding or like of what that job's like? Because I guess the whole point of it is to show that you are aware of like what the job is going to be like. There, is there,
Well, I think, do you mean in terms of doing the virtual shadowing or in real life?
either or, I don't know.
Yeah.
Either.
Well, I mean, so an easy way, if you're looking for like a way to check off the box, I think an easy way to do that is by doing like an HRI. You can do 1/4 of HRI and then say you spent time in a hospital. It doesn't matter. I mean, if you're in the HRI, you're still helping patients, you're helping them feel comfortable, you're doing a lot of things to help with the team. So I'd say that's an easy way to get that kind of that hospital box checked off. And you want to take it to another level, I would say become a scribe. I don't think there's anything, I think anyone who's capable of being a scribe should try to be a scribe. Not because I think it's like better than anything else. I just think it's an easy way to get into a hospital and really get a taste of medicine. I've had people who scribed and came back to me and said, after scribing, I realized medicine is actually not what I want to do because I didn't realize it was like this. And that's okay. That's much better to figure that out before you spend $200,000 doing it, right? So I'd say getting in a hospital at any point, and just, I don't know if there's like a point in time, like, you know, if you go on day one and then you know, after your first shift, you go home and throw up and you're nervous and you realize you hate being in a hospital, maybe try another day or two. Like, don't give up after your first encounter. Maybe you just had a bad day. But I don't know. I think every person knows for themselves when they realize it's not the right fit. You know, I think that's something that everyone needs to be honest with themselves about. If you go to a hospital and you feel energized, you feel excited, you want to help, you feel like you want to jump in and do things, that's a good sign. If you leave feeling nauseous and you hated that, you should pay attention to that feeling, right? That's awesome, Lisa. I'm glad you got that experience. Any questions? So people do all kinds of things to get into med school, and I really think that you should never limit what you do because you think you're pre-med or you are pre-med and you think you can't do that because you think it's not for med school. To me, that is one of the most sad and depressing things I hear people say. They'll say, well, I can't, I got this opportunity to do this really cool job or go to this really cool place and do this thing, but I can't because it's not pre-med. If I could help everyone understand, again, I just can't drill this in enough. Med schools don't care what you do. Actually, let me tell you a story. When I sat in on the admissions committee, very rarely do they actually know your names. It's very hard to remember so many names because they're looking at like 40 to 60 applicants in every committee meeting. And so they don't know, they can't remember everybody's name. I mean, we shouldn't blame them for that. However, what they do is they assign things to people. So one guy I remember, and this has been like, what, 10 years, I still remember this guy. He was being presented at the committee, and his main activity in college was dressing up like a clown and going into the hospital and performing for children. And so the committee was laughing because they were like, so he's going to get in, he got into med school by being a clown, and everyone was laughing about it, right? Yeah. He was from that point forth, he was known as Clown Guy. But you know what? Clown Guy got into med school. Do you think Clown Guy cares if he was known as Clown Guy? Probably it's better to be known as Clown Guy or rather than the other person who didn't do anything interesting and didn't get into med school and nobody remembered that person. So another person who got into med school because she was a tattoo artist. And they were just all really, you know, excited and thought that was really cool that she worked as a tattoo artist for a couple years after graduating college. Another guy got in, he was a firefighter. He literally during college worked as a firefighter and went around putting out fires. So people got into med school usually because they didn't do things that were typical. They got into med school because they did whatever they wanted. At the end of the day, like, there are always a lot of people who get into med school checking off all the boxes. That's common because they have to fill a lot of seats in med schools. You know, if you're looking at 100 applicants, most schools have to accept 2.5 to 1. So if they have 100 seats, they'll usually have to accept about 250 people to get down to their 100. So, you know, 250 people, there's a lot of pre-meds, and a lot of pre-meds do the same thing. So typically, like statistically speaking, a lot of people will check off boxes and still get into med school. But the ones, in my experience, the ones who get lots of acceptances, that's what you really want, right? When you get a lot of acceptances, then you can start bartering. You can start, negotiating your financial aid packages. Then you have a lot more power. So there's the applicants who barely get into med school with one acceptance. And then there are the applicants who get 5 or 6 acceptances, and they get to negotiate their financial aid packages. And I assume most of you would want to be what I would call a competitive med school applicant, rather than kind of barely getting in, seeing how it's going to go. And in my experience, the ones who are more competitive are the ones who do whatever the heck they want, and they don't worry about whether it looks good or not on an application. Because at the end of the day, all they're trying to do is show the med schools who they are as a person. And who you are as a person is more than just your career goal, right? It's more than just your job. It's, you all have interests and passions and things that you love and things about yourself that you would love for the school to know. But you can't just walk around declaring things about yourself. You can't just walk around saying, well, I am a great critical thinker. I am a great leader. I have great communication skills. Do we like people who walk around bragging about themselves like that? Are they generally admirable people? No, they get on our nerves, right? So we don't go around bragging about ourselves. We have to show them who we are. We have to show them how good we are at certain things by choosing activities that reveal that. And then, of course, we help you. I'm going to show you in the future, like how we craft our language so that it shows those competencies. But at the end of the day, you can do that with anything. When we do our experiences talk in a couple of months, I'm going to make one of you tell me how being a fry cook at McDonald's is just like being a doctor. And you're going to do it. You will prove to us that being a fry cook at McDonald's is just like being a doctor. You could do anything and convince them that you're going to make a good doctor one day. Okay, so as you go about this, especially our first and second years who are here today, I really, really want you to understand that you should never turn something down if you really want to do it because you don't think it's appropriate. For our third and fourth years, most of your experiences are done already. But what I would encourage you to do is not be afraid to talk about those things you might have done that you might have thought were not pre-med enough. And maybe we would, I hear this all the time. People are like, well, I'm not going to put that on my application because that's not pre-med. And you absolutely are going to put it on your application for the reasons I just stated. You're going to put all the things you did on your application and show them who you are as a person. All right, so let's move into some not so
Joanne,
exciting topics. Yeah.
There's a question in the chat box. I think you.
Oh, okay. Is
could
it good
answer.
to incorporate life-changing internships outside of UCB for academic credit that would show an academic? You're talking about study abroad? If you're talking about like a study abroad, or I guess okay. Yeah, so if you, even though you got academic credit, so typically, I mean, this is little blurred lines here. Technically, you're not supposed to list things in your experiences section if you got credit for it, but every person does it. So, you know, most of you who had done research before, you got academic credit for your research, but that doesn't mean you're not listing it on your application. You are going to list it. And so I think this is the same thing. If you did something off campus, you got credit for it, you would talk not about the academic aspect of it. Of course, in your experiences section, you would talk about how it affected you, how you changed, how you grew from it, something like that. So yes, I think, Lisbeth, the short answer is yes. Okay. Are we clear now about how to approach thinking about what we should be doing in terms of answering the question who we are, or who are you, for the med schools? Okay, so I want to switch gears, and yeah, so that's a great question. Can we incorporate hobbies? You all, if you're working with HPA, we will tell you, you need to have one hobby on your application. Yes, you should absolutely have a hobby. If you don't have a hobby and you have no outlet for stress relief in your life right now, that makes me so sad for you. It makes me nervous for you and your future with your own mental health. You all should have some outlet where you can do something you enjoy that is not work related. Work is school right now for you. Okay? Yes. Yes, keep the questions coming. I don't know, I have to minimize the chat in order to see my screen. So it's also helpful if you just want to unmute yourself. Or Doug, I guess you can chime in on their behalf. Okay. So this is a chart that I pulled directly from the AAMC. So one thing that I think also, just to kind of advocate for the use of professionals in your advising opposed to using peers, is that at HPA we have access to all of this data. We can pull reports from the AAMC about UC Davis students or applicants. We can see everyone who applies, where they get in, and the things about them. So we can see their MCAT, their GPAs, and how many schools they got accepted at and where they ended up matriculating at. And so that's important. I'm a big believer in using data to drive our decisions and understand, when I say to you that you have a 3.4 GPA and a 5.11 MCAT, I can say to you with confidence that you're fine to apply. Why? Because I know that a huge chunk of our applicants got into med school with those same metrics, right? If you ask that question of a PI or of a friend who's sitting in your class with you, they will probably tell you no. Oh no, if a 3.4 is not nearly high enough, you should do a post-bac program or get a master's degree or some other nonsense. And that's just not the case. Like, people get into med school with all kinds of numbers, like I've already said to you. And I just want to stress that to you, that you really want to go to the people who actually have the information. All right, enough plugging HPA for today. Here are our stats for MCAT. For, what am I looking at? No, this is not MCAT. I'm so many numbers in front of me. These are our number of applicants. So for the last 5 years, this is how many people applied to med school and how many people got into med school, and so our acceptance rate. And as you can see, sometimes the higher number of people who apply oftentimes affects the acceptance rate. So our acceptance rate dropped, 4% last year. And I think it's because we saw a spike in the number of people who applied. And sometimes people apply to med school and they kind of have a mentality of like, well, I'm just going to see how it goes. And sometimes people, there are people who are ready to apply to med school, and when they apply, they usually get in. And then there are people who are not ready to apply to med school, but they don't have anything to lose. Their money isn't an issue. They don't care. They're just like going to see how it goes. So they throw in their app, and then that affects our numbers. We're never at HPA going to tell you that you should not apply to med school. We will give you our honest opinion and tell you when we think maybe that you're not ready. Maybe you could do some more things to get ready to apply. But at the end of the day, it's always your decision. And so I just want to share that with you in case you were curious. The national average is right around 40%. It's like a little bit lower than 40, but we're right on par with the national average right now. Any questions about that?
Joanne, there is a couple more questions about experiences when you have a moment.
Oh yeah, absolutely.
The first one is, as a fourth year who's struggling to get experiences, what do you do?
Well, honestly, if you're in your fourth year, you probably already have experiences.
It was specifically in regards to COVID, by the way.
Yeah, but I don't know how COVID affects that. I think that if you're in your fourth year of college, you should have already you have 3 years of experiences, and unless you did nothing for your first 3 years of college. So if you're in your fourth year and you're applying this spring, then at this point, actually, you wouldn't be scrambling to get experiences because you would have already had the bulk of your experiences done. And if that's not the case, and that you don't, so on AMCAS, you have 15 slots to put your experiences, only 15. You can't put 20. So what I would encourage you to do is to open up a Word doc, number 1 through 15, and start from the summer after you graduated high school, and just start listing every single thing that you did during your time. Every single thing you did includes every job you had, every volunteer activity you did, every club you joined, every single thing you did in college. What happens 90% of the time is once people do that work, they actually realize they have more than 15 experiences. And at that point, you actually don't need to do anything else because you can't put more than 15. So if you have 15 already, you can stop. You don't have to worry about it. And you're certainly not disadvantaged if you can't do anything during COVID because most of the nation is shut down, and was shut down for a bulk of the time. And so that's nothing about you. I mean, some people are finding things to do despite COVID. It's such as volunteering in their community, doing e-health things like e-scribing, or crisis hotlines from their home. Some people are tutoring from their home. Some people are getting jobs, just in their communities, like at grocery stores or restaurants or wherever. I don't think that it's impossible for you to find experiences during COVID, but if you choose not to because you're choosing to quarantine, I certainly don't think anyone's going to hold that against you either. So I would say if you can do community service in your community right now, I would try to do that at least and look for anything. It doesn't have to be medical related. If you're in your 4th year and you have 0 medical or clinical experience, then I would argue you're not ready to apply to med school and you should wait another year, and maybe after things open up with COVID, you can start finding something to get you into a hospital. Hobbies are part of the experiences. You would have one hobby and you put it in your experiences section on one of those 15. And yeah, absolutely, Tracy. That's exactly what HPA does. And you can make an appointment at our website. Maybe Doug can post it. Oh, he already answered that question. And yeah, we'll go through everything with you and we'll give you our honest opinion about whether you should apply or not. Again, we're not telling you whether you should be a doctor or not. That's not our business. But we'll tell you whether you're ready to apply. Yeah, absolutely, Tone. All work experience goes in your application. So people often ask me, I worked at Subway for 2 years I was a sandwich artist. Should I put that in my app? Absolutely. Every single thing you did goes in your application. And if you were working, that's time you spent when you weren't volunteering. And so if you're not volunteering your time, then you need to show them how you spent your time. If you weren't volunteering and you weren't working, then they're going to assume you were Netflixing or gaming, and you don't want them to think that, right? So you need to show them how you spent your time. Okay. Yeah, Doug, just feel free to interrupt me if there are more questions. I'm not going to keep the chat open because
Yep, I'm keeping an eye on it.
Thanks. So here are the breakdowns of our Mcat scores, averages for the various years. And HPA started at UC Davis in 2014. So HPA is only 6 years old. So that's why we don't go further back, obviously. And for most of you, it's kind of irrelevant anyway. But these are our averages. So if we look at our Mcat, our accepted averages are around 509. And again, that is lower than what a lot of people think. Oh no, that's not accepted. This is just no, that is accepted. What am I looking at here? And then in terms of GPA, so our applicants were 504, and then our accepted was 509. In terms of GPA, our average is around 3.6, which is I think that's normal. That's about what the national average is. However, it's really tricky for people because when they look at schools averages, like if you look at the MSAR is the Medical School Admissions Requirements book or website, individual schools requirements are much higher than this. You're going to see things like 3.7 and 514, and that can be a little misleading. And so you might wonder, like, well, how do Davis students, get in at 509s? Well, most schools understand that state students who go to state schools, their GPAs and numbers tend to be a little bit lower than students who go to private schools. And so there's a whole, we could probably spend an hour talking about that, but that's sort of like a common knowledge sort of thing. So it is, I think, different. If you come from a state school, the expectations are a little bit different. For example, the average GPA of students in CBS, College of Biological Sciences, is 3.3, the whole college. So if the whole college average is 3.3, then a student who gets a 3.6 obviously is above average at UC Davis if they're taking a lot of science classes. And then the BCPM, which for allopathic med school is what they call the science GPA. That's all science classes, not just biochem, physics, and math. That's every science class you took was 3.5. And that's actually pretty high. I would say a lot of our applicants don't end up having a 3.5 science GPA. If you do, that's fantastic, but that's pretty high. So this is our number. These are our numbers compared to national data. And so nationally, we see averages around 3.6, and I think we're pretty on point. I'm not sure why the numbers are slightly different. I think I might have checked off an extra box here that included a group of people that I didn't in the other one. But yeah, we're at a 3. Oh, I'm sorry, national average is 3.7, and we're at a 3.6. There we go. CUM undergrad is what I'm looking at, the last row. And then for GPA, Same thing. We're pretty close to national averages. We're just a point below in almost all the categories. So what does that say to you? What do you think when you see this? When you say they don't count psych, what does that mean? I'm not sure oh, they don't count psych in your GPA. That's correct.
Yeah, there was a question about calculating BCPM.
Gotcha. So when you see these numbers, and I'd like to hear just some of your thoughts. What are some of your thoughts, initial thoughts when you saw this? Was anybody surprised by anything they saw? And if so, what surprised you? Lower than expected, okay. Now, Julia, why do you think, like, first of all, where did you get your information before?
Well, to be like honest, I guess transparent, is that I guess I limited my research to only really looking at like the higher name medical schools, and I really only ever looked at like I understood that there's so many different med schools and you don't only have to go to like the high name ones, but I only ever looked at those. So yeah, that's what I was working with, of like the 3.8 range, 3.7 range, stuff like that.
Yeah, and I mean, there's nothing wrong with shooting for high schools. I would argue that, and we're going to talk about this so much throughout the year, especially when we talk about creating your school list, most people at Davis apply to between 25 and 30 med schools, and there's so much strategy in which schools you pick, and so much of that will come back to the numbers that you have. So if you end up having a 3.6 and a 512 Mcat, I don't think it's strategic to list only high-tier schools. All California schools are going to be high-tier schools for all of you, regardless of what their averages are. It's very, very hard to get into a California school, and about 60% of our students go out of state for med school. So for Californias, there's no rhyme or reason, there's no formula, there's no way to predict whether you're going to get into a UC. And so I really like to set that stage really early and clearly, that your numbers are not going to indicate whether you're getting into a UC or not. I've seen lots of people with really, really high numbers not get any interviews at UCs, and people with average numbers get interviews and accepted at UCs. There's nothing about your numbers that has any correlation to that. However, when it comes to out-of-state schools, the numbers do play a role, and here's some examples of how. Let's say, for example, you have a 399 and a 520 Mcat. That's a real, like, I call you a high roller, right? You're a high rolling applicant, right, at that point. So if I'm an out-of-state school, there's tiers of out-of-state schools, and I'm not going to classify them so simply like that, but there's high-end schools like Ivy Leagues, and then there's lots of middle-tier schools, which are perfectly good enough med schools you get into, and there's some schools that they typically are a lot more holistic, and they typically will take people with lower numbers, and we know which schools those are too. So if you have a really high MCAT and GPA, and you apply to only low-tier schools, what might those low-tier schools assume about you? I just realized the time. I got to stay on track with time. We have about 9 minutes left. But really quick, can you imagine what a low-tier school might assume about someone who applies to them with high numbers?
They would think you're like sandbagging, I would think.
Oh, I'm sorry. I had a hard time hearing that.
I would think they think that you're sandbagging.
I don't know that phrase, but I think what you mean is that you're using them as a safety school.
Yeah, like you're playing in like the league below what you should be at. Like you're trying to play it safe, I guess. It's like
yeah, but will they interview you?
I would think they would probably still interview you, because I mean.
Yeah. Well, let me tell you what I think is going to happen. I think that if you have high numbers and you apply to a low tier school, there is an assumption. This might really surprise you all, but out of state schools, there is this weird assumption that all of you would actually prefer to stay in California. So weird, right? I don't know why they got that in their heads, but somehow they all know that every school that you apply to out of state is actually a safety school. They actually think you would prefer to stay in California. Now, they all know that. And actually schools create separate admissions processes just for California applicants. How do I know this? Well, when I was hired to be the director of admissions at one medical school in New York, I had to learn that job. So what I did was I went to other med schools in New York, and I was trained by their directors of admission. They told me things, right? They taught me how they did their processes. So I know for a fact there are schools that created entirely separate screening processes just for California applicants. I know this because they told me all about it, and this is how we did it. And the reason they do that is because they know that California applicants do not want to go out of state for med school. Now, here's a couple other things. So med schools can start sending acceptances as early as October 15th. They cannot send an acceptance to anyone before October 15th. Most med schools will send all of their invitations to interview early, like around September, October. They'll interview a few people early. But what happens on October 15th if you got into your dream school? Are you going to still keep interviewing at all the out-of-state schools if you already got into a UC? You're going to, usually in a normal year, would you pay and fly all over the country if you got into UCLA or UC Davis med school? You're going to keep going through all the process of interviewing? No, you're going to withdraw from those schools. You're going to say, oh, I got into my dream school, I'm done, right? So if you're a high-tier school or high-tier applicant and I'm an out-of-state school, I'm going to assume that you have a good chance of getting into a California school. So am I going to waste one of my beloved interview spots on someone who doesn't really want to come to my school? Not necessarily. Now, that's where strategy comes in. If you want to get a lot of interviews at a lot of other schools, it is your job to convince every single school that they are your #1 school. And we're going to talk all about how to do that. But there's so much that comes into play. This is a very human process. It's very strategic. And there's a lot that comes into play regarding your numbers. So if you have low numbers, you would not apply to high-tier schools just because you wouldn't meet their requirements, their averages. But if you're a high-tier student, it's sometimes like the expectation is that you would only apply to high-tier schools because high-tier schools are used to seeing people like you. They wouldn't think anything of it. And high-tier schools like Hopkins and Harvard and Yale, they actually have the money, and they would, it sounds so bad when I say this, they will pay for you. They will pay for you. They will give you scholarships if you're a high-tier applicant to buy you so that you would be more willing to come to their school. So a lot of private schools will actually do tuition reduction so that they'll make their tuition the same price as a UC to try to convince you to come out. That's what they do. But they only do that for competitive applicants. They're not going to do that for anybody. A competitive applicant has nothing to do with your numbers. A competitive applicant is someone who has multiple acceptances. So if you might have a 399 and a 525 Mcat. If you have one acceptance, you are not competitive. You're going to go to the one school that accepted you, period. If you have a 3.2 and a 510 and you have 6 acceptances, you're in a position of power. You get to decide which school you go to. They all are going to want you if they accepted you. So you get to decide where you, and that's when you can start saying, well, I got a half scholarship at this school and it cost me this amount of money out of pocket to go here. If I come to your school, it's going to cost me $10,000 more. So that's a really hard decision for me. I like your school, but paying $10,000 more is a lot. And that school's going to be like, oh, wait. You need to tell them how many acceptances you get. You absolutely would tell them all of this. You have conversations with them. You share that information. And that's stuff that we would help you negotiate when you get to that point. You're not going to have this conversation with schools before you get accepted. Absolutely not. But once you get accepted, then you can start having those conversations. But you have to get multiple acceptances first. You can't ask for money if you don't have anything to, leverage. All right. So kind of going back to these numbers.
There was a quick question about do California schools have an implicit bias to have California students?
Yeah, they absolutely will. Most of them will accept, like, for example, UC Davis is almost entirely, I don't think they've taken an out-of-state student in quite a long time. The bar for out-of-state students is so high, so they don't typically take any out-of-state students at UCs. So that's, if you are out of state, that's, you probably want to change your residency to California if you're trying to go to a UC. What's the why? Why do they not take out of state, or why would you change your residency? Well, because they're a state school, so they're state funded. They have state mandates to take students who will serve in their own states. So same thing with out-of-state schools. So like, let's say you're applying to University of any of the states, right? They're going to have the same mandate. They're going to have the same limits. Their mandate is to accept people to serve in their states. And if you aren't going to stay in their state, they don't want to waste a spot on you because they need people to serve in their own state. In every single state in America, there are underserved communities. In every single state in America, there's a shortage, there's a physician shortage. And so state schools are usually mandated by their Congress to like increase and produce physicians to serve their state's needs. And so, yeah, they don't want to take someone who's just going to turn around and leave. That doesn't meet their mission. However, private schools don't have that mission. And so most of you, if you do go out of state for med school, will end up most of the time going to a private school. And that's okay. Private schools have more resources to, like I said, do more tuition discounting anyway. State schools don't usually have the same resources that private schools do. All right, that was a lot. I know that we always have so much to do in these sessions because there's just so much I could tell you, and I try to tell you as much as I can as topics come up. But what I can say, I'm going to turn it over to Doug in just a couple of minutes for our next, the second half of the portion. I hope today was helpful to you. I hope that you learned something new. And I would encourage you to put the rest of the dates on your calendar and make sure that you come, because I will continue to do this. I will continue to put up some information and tell you everything I know about each aspect of that application. And I hope that you come with questions. And if you have questions, like write them down. And next time we can start with questions, you can post them. We're going to put this on the MedPrep page on the website. We have a MedPrep Facebook page and a MedPrep website. So if you are not on the Facebook page, I would encourage you to get on the Facebook page so that you can see if we have updates. And we actually post a lot of med school related stuff on the MedPrep page. So it's kind of fun if you just want to read some like stories and get updates on Mcat stuff, things like that. But yeah, I think that this is always fun for me because it's kind of the only place where I can just really be honest and talk about what I've learned over the years. And so if you come to every session, you do get to take the mock exam, but I think it's just fun if you come to every session because then we're going to get to know each other over the course of several months. What I typically see is by the end, we usually have half the group we started with. So by the end, we all get to know each other, and you know, it's a much smaller group, so it's more fun. So I will, with that, let me just see. Oh, we didn't talk about timelines. So some of this I'll roll over. I think most of you probably already know this stuff, and we didn't talk about this timeline. You know what I'll do? I will make sure that for our next session, I roll this over to the next one so that we can start with this, and I can make sure that we get through all of this stuff too. All right, so we are going to take, what did we say, Doug, a 5-minute break or a 10-minute break?
10-minute break.
Okay, we're going to take a 10-minute break and let our Princeton review instructor come in, and she's going to kind of go through the big pieces of the MCAT and get us starting to thinking about setting up our plans to prepare for that if you're taking the test in September of 21. You're very welcome, everybody. It's always fun to talk to all of you. Thank you for asking questions. And yeah, I'll turn it back over to Doug.
Okay, and I'll post it again after the thank you sort of die down. I'll put the link to the MedPrep Facebook page where you can find links to the recording when it goes up and all kinds of fun information, such as the AMC releasing their schedule for next year's MCATs and the fact there's going to be 2 per day. So you got to get used to taking your test at either 7:30 a.m. or 3 p.m. if you're going to be taking your MCAT. So better than taking it until midnight, I suppose. So here is the MedPrep page. And go ahead and take a break. We'll be back shortly with a little bit of information about the MCAT.
Hey Doug, it's Christine. I just wanted to say hi. I know we're having a little bit of a break, but I'm here with the Princeton review for whenever you're ready.
All righty. Hello, Christine. I think, Joanne, can you set her as co-host? Because I don't seem to be able to. I think Joanne may have stepped away. So
No
we'll wait
problem.
for just a moment.
No problem. And thank you for having us, Doug. I know you just muted, no need to unmute, all good.
No worries. Thank you for coming.
I'll turn off my video and I'll mute myself until you guys are ready for the next session.
Okay, sounds good.
Great, thanks.
Alrighty, folks, head back in the next 2 minutes and we'll get started again with some talk about the Mcat. All right, it's going to be about that time, so everybody pop back in the chat and let me know you're back by telling me what's one thing you learned from Joanne earlier in the session. Out-of-state schools don't like Cali people. That's a nice, succinct way of putting that, I suppose. Oh, you guys are cheating, just doing the double arrows.
Actually,
Cheaters.
That's not true at all. I want to make sure. I want to chime in real quick. That is not true. They actually take a lot of California people. What they think is Cali people don't like them. That's the difference.
Yes, very true. Failing is good. Love that one too. Hobbies, yes. So it looks like we've got a good number of people coming on back. So thank you guys for being here. I wanted to thank you guys. I wanted to welcome Christine from the Princeton Review. Christine is here to tell us a little about the Mcat as a whole, what the test is about, and what you might be facing when it comes to the Mcat. So I'm going to go ahead and pass this on to Christine, and I'll again stay in the chat and answer any questions you might have and redirect questions to Christine should they come up. And then away we go. So thank you for coming, and Christine, take it away.
Thank you. Thank you so much, Doug. And Joanne, I wish I would have started sitting in earlier because your advice is so tremendously helpful. So what a great resource that you all have at Davis. My name's Christine Cather. I'm the grad programs outreach manager for California for the Princeton Review. We are going to go over an overview of the Mcat. And I understand that then you are going to have some content-specific sessions as well. So to start with, can you guys type in the chat and let me know what year in school you are and when you plan on taking the Mcat, just so I get a sense of where you are right now. Okay, thank you. So we have a wide range. This is great. Okay, Thank you all. So I am going to minimize the chat. So if Doug wants to just pop in, if there's anything that I'm missing, please feel free to pop in. And if there are any questions that I cannot answer for you, please don't hesitate to reach out to Doug or myself to let me know, and I will get the answers for you. So welcome. I am with the Princeton Review. Better grades, better scores, better applications equal better schools. And again, you are so lucky that you have amazing resources, and we just encourage you to utilize them. I heard a little bit about talking about the med school admissions process, so I'm going to skip through a couple of these. More students are denied than accepted to med school each year. And all of the information that you're hearing throughout these workshops and meetings are not meant to scare you, they're meant to prepare you so that you can be one of those students that makes it down to the bottom of the funnel. Typically when we're doing these in-person events, I see students with the deer in the headlights looks, and that is not what we're intending. The more you know and the more prepared you can be, the better off you will be. So most schools primarily screen initially with that GPA and that MCAT score. So we want to make sure that you are fully prepared to take the MCAT when you are scheduled to. So make sure that you've taken these courses, and once you've completed these courses, you are then ready to fully dive into your prep and be successful on the MCAT. And I'll give you a second just to take a look at these. So I saw some data that you guys had up on the screen earlier with Joanne. So this is a little bit repetitive. But as you can see, we have the applicant GPAs and MCAT scores, and then the matriculant GPAs and MCAT scores comparing 2019, 2020 to the year prior. But for the actual MCAT, it's required by US and Canadian medical schools and required for both MD and DO programs. So what does it actually test? So it tests knowledge of scientific concepts and principles, scientific reasoning and problem solving, reasoning about the design and execution of research, and data-based and statistical reasoning. So I'll leave it up to your counselors to start reviewing more about, how many hours you should have for clinical experience and what you should consider if your GPA isn't quite where you think it should be. So I'm going to skip through this and get basically to an overview then of the MCAT. So you have the 4 sections. You have Chem Phys, then Critical Analysis and Reasoning Skills, CARS, Biochem, and Psych Soc. So there will be multiple choice, 4 choices per question. You'll have A through D. And what's so important when you go through your MCAT prep is not only making sure that you are familiar with the content, but that you're doing the practice exam so you get used to the timing and the pacing and how you can really maximize the score. Because not only are you focused on the content, but there are other constraints on you in terms of time and extra stress. So it's balancing all of that, which takes preparation. Similar to running a marathon, you don't just go and do it. You have to build up. So we're going to show you, I'm going to show you one of the screenshots for suggested kind of prep in order to, what do you need to do prior to the exam in order to start building up? How many practice tests should you take? How do you build up? How do you schedule out your hours to maximize your time? And also, just know that it's all a balance. So don't feel like you have to stretch your MCAT prep over this extended, enormous amount of time. You can have it focused as long as you're organized and stay on top of it. And obviously with the Princeton Review, we do have great MCAT courses that are geared towards specific test dates. So they take a look at the test date and then work backwards from there so that you have the right amount of prep, and then you have some time to yourself, and then you dive into your exam. So word on the street now recently that has come out is that they're going back to the full-length exam, which is in the blue. For 2020, during the COVID period of time, they had the shortened form of the MCAT, which was in the green. So you might be talking to friends who are telling you how many questions they took on their exam if they recently took it. So just know that there are the 2 versions of the exams, the full length that was prior to COVID and we're going back to it in 2021. And then there was a special shortened version that some of your friends may have taken or classmates may have taken if they took it more recently. So that, just to understand the difference, it's the same content. You just have more questions in the full length exam, but it was the same amount of time per question. So don't feel like, oh gosh, you know, I missed out on the shorter exam. They covered the same amount of content. This total seated time is about 7.5 hours for the full length exam. So the MCAT sections, what is covered then under Chem Phys? Here you can see, I probably don't need to read this aloud, you can see it on the screen, but take a look at all that's covered and what that breakdown is like, and you'll have 59 questions in 95 minutes, 10 passage-based sets of questions, and 15 freestanding questions for Chem Phys. And again, I hear that you guys are going to have breakdowns specifically of the content, which is great, so I highly recommend those. And then for CARS, you have 53 questions in 90 minutes and 9 passages, 5 to 7 questions per passage. And keep in mind that this is all on the computer screen. So practicing reading those passages and getting through those questions, knowing how to use the computer functions to highlight, to mark things, all of that is part of the prep, because you want to be as comfortable as possible when it's time for you to actually go in, sit in front of the computer at the test center and take the exam. You don't want anything to throw you off. You want to be as prepared as possible, not only with the content, but with your timing, your pacing, the computer functionality, using the whiteboard. You'll be getting a whiteboard as scratch paper. How are you going to utilize that? So practice all of these prior to the exam so that when you are finally sitting and taking the exam, you feel completely confident and ready. And then here for biochem, 59 questions in 95 minutes, 10 passage-based questions, and 15 freestanding questions. And then for Psych Soc, and here you see it, and you've seen it on the prior screens too. They do mix a little bit of other content within that subject. So even if it's Psych Soc, you'll see about 5% biology. So just be aware that it's not completely focused. If you get questions where you're like, wow, this just seems a little bit not like it should be in the section, just know there's a little bit of a mix, and that's why they had the breakdown for you on the slides. You have 59 questions in Psych Soc in 95 minutes, 10 passages, and 15 freestanding questions.
So there's a question, Christine, about what is a freestanding question?
Oh gosh, okay, freestanding question. I'm actually gonna get to that in just a little bit. So we're gonna compare if you're faced with passage-based questions, so there's a passage on the screen, and then a couple of questions based specifically on that passage, or a freestanding question, meaning a question that stands on its own, not related to the passage. Does that make sense?
Thank you for the answer.
Okay, and I see a couple of nods, and something to think about, and I'll go into it a little bit more, and I'm sure your instructors will go into it as well, is for those freestanding questions, are those questions then questions you might want to attack first when you're considering time? Are those questions, maybe you want to get to those, mark some of the passage-based questions, and return to the passage-based questions so that you can make sure to get as many as possible. So there are things to consider, and you learn this through the practice, doing practice problems, doing practice tests, doing sections of practice tests. You learn what works for you best and how you can work through the exam and maximize your score by getting as many questions correct as possible as you're going through the exam. So the MCAT score reporting. If you think you've tanked, you have 3 minutes to void. You can void on test day only. Scores cannot be reinstated. Voided scores do count as an attempt, and there are no refunds. However, what we suggest is if you've practiced and prepped, you should be ready. Unless there was some sort of a health emergency that's taken place during the exam, we feel confident that you are ready. If you've taken all the practice exams, if you've done all the drills, if you've done everything that we suggested to you during our course, or if you're prepping on your own, if you're following along with some sort of outlined strategy, you should be good. Don't use that as a crutch. Again, be as prepared as possible so that you're not even relying on that function. Scores are available 30 to 35 days after the test, and they're accessed through your AAMC account. Okay, and tips for protocols that are different now, but that they occurred during the COVID era that maybe your friends who took the MCAT a while ago didn't have to deal with. So you always want to practice at the same time of day that you'll be taking the actual test. So prior to COVID, there was one time of day. I always run into some night owls who are always a little bit like, oh my gosh, this doesn't work for me. I do my best at night. And all of a sudden COVID hits and there's an evening exam. And those people were like, yes, this works for me. But now you do have the two different times, and I will go through all of that. But also what you're going to have to deal with if you are taking the exam in this period of time is that if the health conditions are such that require masks, you will be taking your exam with a mask. So given that it's a 7.5-hour exam, there's a lot of stress already. If you are not practicing the way you will actually be taking the exam, that might hinder you on the day of the exam. So if you are going to be taking the exam with a mask during 2021, then we suggest that you also do the practice exams with the mask. They do allow people to wear gloves if that is a concern. Again, if you are going to be taking the exam with the gloves, you probably want to be practicing them with the gloves because then it's the functionality of the keyboards, the highlighting, the marking, all of the functionality that you'll be using when you're marking through those passage-based questions, as well as how you'll be doing with your whiteboard and writing with that if you decide to use the gloves. So just like the marathon, you want to practice the way you'll actually be taking the exam so that nothing is a surprise or uncomfortable on the day of the exam. So these were just different pieces that I pulled from some of our books, and I'm not going to go into too much detail because I'm so happy that you get the luxury of the instructors really going through all of this, but they will walk through different strategies for science. So for example, someone asked, what is the freestanding question? What are the passage-based questions? And how do you decide then which questions you want to do first? The instructors are going to go through, and Doug, and everyone does have access to those content-based classes. Is that right, Doug?
Yeah, we're going to be doing, just to talk about what she's bringing up here, is in each of the sessions from this point forward, once a month, we're going to be having a different subject. A Princeton Review instructor is going to be presenting on chemistry, GChem, OChem, physics, bio, psych soc, and cars. So
awesome, thank you. And so that's once a month over the next couple of months. Is that right?
For the year of the program, yes. This will go all the way through to next year.
Okay, great. So you will be able to work one-on-one with the Princeton Review instructors, and they are going to be breaking this down, talking about how you should decide to skim and rank these passages. Is it a passage that you want to do now? Do you want to skip it? Are you going to review afterwards? How are you going to mark that? Not only on your computer screen, but also your scratch paper or the whiteboard. You will be given a whiteboard with a dry erase marker. And it is so interesting that most people don't even really consider the usage of the whiteboard as part of the strategy, but it is a very important strategy to start implementing, because as you're going through your questions, you want to be able to, if you mark a question to come back to later, you want to make sure that on your whiteboard, you have the question noted, what passage it is. And if you are able to eliminate some of the questions or some of the answers within that question, if you've eliminated them on your whiteboard, now when you come back to them, at least you're saving some time by not reconsidering some of those answers that you've already dismissed. Does that make sense? So the whiteboard / scratch paper ends up being a very helpful tool for you if you are organizing it and using it properly. And again, that just takes a little bit of practice. And then the same thing, I'm so excited that you're going to get to work with our CARS instructor too. The instructors that we have for the Princeton Review are experts in those specific subjects. So we make sure that we have top people for each specific subject working directly with you so that you get the best advice from them. So for those, I highly recommend that you join us for those sessions. If anyone is concerned about possibly taking a course soon, let me or Doug know, and we can make sure to get you set up. We also have an MCAT week coming up next week that will also be subject specific. I know that you're going to have that year-long program, and that is going to be awesome because you want to be able to spread it out and really be able to absorb everything. But just in case anybody is looking to take their exam or they kind of want to get a sense of everything sooner, we do have MCAT week next week, which is free, and I'll put a QR code up on the screen at the end. And you can register for those hour-long content-specific workshops as well. So just so you know. So this is an example of what you would see on the screen. So a passage-based question. You could see here then you have passage 1, questions 1 through 3. So unlike the SAT or ACT where you could prior flip through the actual pages, it's a little bit different and takes practice to have your passage on one screen and then have the split screen with the question. And you can then see how you can also mark through some of the questions, how you can highlight. You don't want to end up with a whole page of highlights that now when you go back through, you know, nothing is important because everything was important at the time. So it just takes a little bit of practice, and I'm excited to have you guys have the opportunity to work with the instructors so that you can get a better sense of what you can do to really maximize the tools that are provided for you on the computer-based exam. The instructors will also go over pacing. You want to maximize the number of correct questions by doing the questions and passages in the order you want to do them in within each section. But again, that takes practice so you know what your strengths are, what your weaknesses are, and how you can best mark, keep your whiteboard organized, and come back so that you can get through as many questions as possible to get the highest score possible. Also, process of elimination. You want to increase your probability of getting the correct answers by eliminating those that you are sure are wrong. So strike through the questions you are sure are wrong and do not address the issue or do not address the issues raised in the question. So time is not your friend during this exam. So if you know that this does not address the issue, then on your scratch paper or on your computer screen, just scratch through. But if it's a question that you end up having to come back to because you've only eliminated 2 choices, make sure that on your whiteboard you also eliminate B, if that's what it is, so that you don't waste time reconsidering it when you come back to it. Also, you want to jot down notes to clarify your thoughts for when you return to the question. Again, just save as much time as possible for when you return to the question so that you can focus right where you left off and you have the notes to spark where you need to pick back up. And do not leave it blank. For sciences, if you're unsure and you spent more than 60 seconds on the question, just pick one of the remaining choices. If you have time to review it at the end, and you can debate the choices. For cars, if you reread, went back and still feel stuck, you can guess on that and move on. If 3 or 4 answers have been eliminated, no need to ponder why. You just answer the question and move on. Again, time is also being tested here, how well you can keep the pace and get to as many questions as possible. You will have a pop-up periodic table of the elements, FYI. And then this is just an example of, okay, I think the screenshot on the right was from a GRE exam, but just an example of how you want to make sure that you clearly number each problem so that you can find your work when you return. So you want to draw a line underneath each problem so you have a clean space for the next problem, and note how every answer choice has been checked and every problem has its own distinct space. So how you organize your whiteboard / scratch paper can really help you when you come back around to that question. Same thing here, you can just see how organized your scratch paper can be. And then this is a sample schedule I just pulled from one of our books. So you can see here, I'll give you a second just to take a quick look at it. So it's really important to be very disciplined as you set your prep for the exam. And like I said in the beginning, it's not this long, super extended over the course of a year type of prep. You can focus your prep as long as you're organized and disciplined. So our courses, in addition to the classes, and right now with the live online classes, the beauty of it is that each session is recorded. So you can go back in and watch it if by chance you ended up having an emergency situation and you weren't able to attend the class. You can still go back and watch it. Or if you did attend the class and you need more clarification or you just need more time with that subject, you can go back and rewatch those sessions, which is great. And then you'll also be assigned homework. All the books, all the Mcat prep books do come with our courses. So we always have students who think, oh gosh, I want to buy the Mcat books now so I can start working on it. But then when they sign up for the course, they didn't realize that all the books do come with it. So I just wanted to give you a heads up that yes, you can register for a class way in advance of the actual class you want to take. And as soon as you register, you get access to the book and you get access to all the online drills. So I just don't want you to spend money on books if you know for sure you're going to be taking one of our courses. And then also in our courses, they have MedFlix, kind of like Netflix, but it's content-specific videos that you can either watch prior to the session so that you have a stronger foundation when the instructor is going through the topic, or you can use it to really fortify the information that they were speaking on for that day. So MedFlix, you can MedFlix and kind of chill, I guess. I don't know if it's that chill, but anywho, all right, I'm old. Okay, so you can definitely raise your MCAT score, but it does take practice and prep. We have a number of courses to meet varying needs, from very intense all summer, morning till night, everyday courses, to winter boot camps. So say you're going to take your test right following the winter and you have that time off in between. We have winter boot camps that are focused, prepped, and you don't have to put a lot of thought into the planning of your prep because it's been planned out for you. We also have courses over the summer that can be broken out Tuesdays, Thursdays, so it works well with your schedule, or Monday, Wednesdays, or Saturday, Sundays. We do also have score guarantees because we do stand behind the product in terms of if you take our courses and do what you're supposed to do all the suggested drills, homework, attend the classes, do the practice test, we know that you can raise your score. So I'm going to quickly pass through more of the med school admissions items because I know that you have that covered already. But here are the 2021.
Christine,
Yeah.
I'm going to interject a couple questions in here just for a moment. There's one question: what's the price for the classes and how do you register? And also, are the classes you mentioned offered by Princeton Review or another organization? And I thought you might address those.
Perfect. Okay, so the classes are offered by the Princeton Review, and MCAT is actually our biggest course. I am going to put my email address in the box because, now let me make sure everyone can see it, because you can email me and we can set up a time to discuss maybe what course might be best for your needs, because we do have, and they vary in price. And then also, are any of you part of any other clubs on campuses, any other pre-health clubs? I just want to make sure. Yeah, email me and then we can talk about different courses, and especially if you're part of clubs, we can also offer resources to your club in general. And then I can walk you individually through maybe what might be best for you. Because we have like our ultimate course, 123 hours, or we have a self-paced course. If maybe you feel like you don't need as many hours with an instructor. So if you guys can email me, did everyone see my email in the chat box? Christine.cather@review.com. And then we could set aside time to talk about what might be best for you. The price range, we can go from, you know what, I can pull it up. Do you mind if I pull it up right after? Because there really is a range depending on self-paced, or it could be like a $3,000 course if it's the ultimate with a 5-10+ guarantee, or it can be, you know, I want to make sure I get the self-paced price correct before I say it out loud. And then also they have different website discounts running at different times too. But if you ever see a website price that you're like, hey, I really want to lock this in, just email us. Even if you're not ready to take the course right then, email us and then we can make something work for you. I just had a student who emailed me, screenshotted the website price for a self-paced course, and the next week the price jumped up. And because he had screenshotted and emailed that price to me and we had talked about it, I was able to get him that original price that we saw online. So princetonreview.com, if you go on the MCAT page, you can see the variety of products and the prices. But I want to make sure too, because I think, has Tiffany mentioned anything with you, Doug, about any like groups, or I'm not sure what was discussed with Tiffany.
Well, we know that Tiffany has set up agreements with different student groups on campus with having discounts through them, and we also have a discount code with them through the HPA. So if you're wanting to get that discount code, just let myself or any of your advisors know and we can get that to you.
Perfect. Okay. Just because I wasn't involved directly in the process of setting up the codes, I wasn't sure what was discussed, but good to know. So please email Doug because he will have specific discount codes because of your partnership, which is great. And then if you are part of a club on campus and you don't currently have a relationship with the Princeton Review, please let us know as well. And recently our leadership team just rolled out, I think within the last month, a new push to really encourage opportunities for underrepresented minority groups pursuing business, law, or medicine. So that was a new initiative. So if you are part of a club whose mission is to enhance opportunities for underrepresented minority groups pursuing business, law, or medicine, please email me for sure, because we want to talk and connect and see how we can help. Okay. Thank you, Doug. And again, email Doug because they did set up a partnership discount promo code. So I want to make sure that you guys get the best price for the course because of the partnership, and we appreciate the partnership. So recently, the MCAT or the AMC released the test registration dates. Typically, we would have October and February, and they would divide up the test dates which you could register for. However, now there are 3 different dates, which is new, and then there are 2 different times. So the standard start times will be 7:30 a.m. and 3 p.m. So when you register, hopefully you get the one that works best with your optimized time of day. And keep in mind, they are going back to the full-length exam versus the shortened form of the exam that was being administered during the high time of COVID. And so MCAT registration for the January and March 2021 exam dates opens November 10th at noon Eastern time. So what happened last year when they opened the registration in October was that a lot of students registered first thing in the morning once it opened Eastern time. So remember, in California, wake up extra early. And then all of a sudden, those lucky students were great. They got their times, their dates, and then the system crashed because everybody else started trying to register. The system crashed, students were stressed. So just do yourself a favor and try to be one of those early ones. And if you can start entering in some of your information by pre-registering when it opens November 2nd, that can at least save you a little bit of time as well. So again, for November 10th, if you're shooting for a January or March date, mark your calendar for November 2nd to pre-register and November 10th to register for the exam. Okay, February, you can register for the April, May, and June dates. And then in May, you can register for the July, August, and September dates. Remember, 2 times a day, 7:30 a.m. and 3 p.m., and then going back to the full-length exam. Okay. Okay, and then one last tool to use is the med school management tool. And the bit.ly link here is bit.ly/medschooltoolkc. this is a way where you can start housing some of the information on your activities, your experiences, your clinicals. It's almost like a portal. And so I just wanted to make you aware of the med school management tool that we have available. And again, it's going to reiterate the things that you are discussing with Doug and with Joanne, so I don't want to go into too much detail. However, if you do take the time to start entering your information into the portal, if you hit print all of a sudden, without having to spend extra time formatting, your experiences and activities will come out looking like this. So now you have something to bring into your pre-health advisors, or you have throughout this experience as you're preparing to apply, so that you can build up those activities and experiences. If you ever do have to prepare a resume, you want to keep in mind the resume is typically 1 page. And so as you're creating different resumes for specific jobs, you're taking different pieces out. So this is a nice way to have everything listed so that when a different type of opportunity comes up, that may be an experience that you didn't have on your last resume, but it lives in the portal, you can take the information from the portal and put it back on your resume. So hopefully that all makes sense. The more opportunities you apply for where you have to keep changing up your resume, you'll start realizing, oh my gosh, I didn't save that version that had this particular experience. So this med school management tool is a way for you to house everything in one place. And I kind of refer to it as the Cheesecake Factory menu. It has everything. And then when you need it for your resume, you can pull the lunch menu or the dessert menu, whatever specific to that type of job. And we want to make sure that you are ready for every opportunity. Be ready to submit for opportunities, be ready to confer with your pre-health advisors, be ready to ask for letters of recommendation, be ready to draft your personal statement, be ready to take the Mcat, and be ready to key in your application. And again, you are so fortunate, just with a little bit that I got to listen to from Joanne, you are such a fortunate group of students, and I love to see the number of you that were on the call, because so many students aren't taking advantage of the resources, the valuable resources that you have right there at your fingertips. So I'm so excited that you guys have all taken those steps. Another free tool, because I love free tools for you, this came out last fall. It's an app, Mcat Flashcards by TPR. So you can have Mcat specific flashcards right in the palm of your hand. You swipe one way if you know the content already and you don't want to keep reviewing that topic, and then you can swipe the other way if that is a specific topic that you need to keep boning up on. So Mcat Flashcards by TPR in the App Store. Again, make sure that you hit all of your marks: better grades, better scores, better applications, better schools. My email address is here, christine.cather@review.com. Again, this was just an overview of the different parts of the Mcat, because we will have subject-specific instructors coming in throughout the year, which is phenomenal. But if you are looking to kind of get it all in one shot as well, and the more information, the better, in my opinion. If you are interested in Mcat Week next week, which is free, they're individual events, you can scan this QR code and then register for the different events. But again, that's going to be a big national event with students from across the country. So please make sure that you also take advantage of the Davis specific workshops with our Princeton review instructors, because you can get your questions answered and get personal. Whereas in the national Mcat Week coming up, they're going to be going over content, but it might not be as amenable to those specific questions that you need answered. So take advantage of every opportunity that you have, and hopefully this gives you a better sense of what all is covered within the Mcat, and hopefully it opens your eyes to some things that you might have thought were as important, but who knew that a whiteboard and scratch paper could really help be a tool for you. That is part of a strategy. And really learning to evaluate the passages, the passage-based questions versus the freestanding questions. How are you going to maximize your time? How are you going to work through the pacing? There's so much that you can do to improve your score. And we are so excited, though, that you are going to be the next set of physicians that will be helping all of us. And that's all I have. Doug, was there anything chat-wise that I missed?
No, so far I think we're good. I'm just going to open it up for questions. So thank you, Christine, for presenting. And does anybody have any questions for Christine?
Did you guys have friends who took the shortened version of the MCAT? Or friends who are going through the process now?
At least, it looks like at least some of them have known people.
Okay.
Somebody is finding that the bit.ly link might not be working. Could you share that again?
Yes, I'm actually, and I'm no longer screen sharing, correct?
Looks like you're not, no.
Okay, so I'm going to I'm going to get to the page itself and then copy the link. So if you guys want to talk amongst yourselves, that would be great.
All right, if anyone has any questions about anything in general, we can do that for a few more minutes until you get the link. And then if you don't have any further questions, we can wrap up for the day. Someone's asking you, Christine, to share your page with the link to sign up for the MCAT.
Oh,
or about the slide to sign up for the MCAT.
Okay.
I think it's the MCAT schedule page, yes.
Okay, let me find the med school management tool real quick. Hold on, I have a lot of different bit.ly links. Hold on just a second.
Okay, so there's a couple questions coming in. We'll let Christine get caught up and then we'll address the questions.
Okay, I'm gonna put in the link for the, okay, so there's the full link for the bit.ly. And then I'm going to pull my slide back up. Hold on just a second. Okay, am I still able to screen share? Yes. Do you mind if I pull up my screen again?
Yep, go for it.
Okay. Okay, can you all see my screen?
Yes.
Okay. And I know it's my whole PowerPoint, but I'll go from the current slide. So that QR code should take you to the registration or to the landing page. And then from there, you can pre-register for each of the events. And those will be recorded typically as well. But I highly encourage you, even if you do attend MCAT week sessions, to attend the Davis-specific content workshops because you can get so much more in depth with your instructors.
Okay. I believe they wanted to see the MCAT schedule page as well.
Oh, the MCAT schedule, like in terms of the dates?
Yeah, the dates and when they can register and whatnot.
Got it.
That one, yep.
Okay.
Okay, so here's a couple of questions for you. Is there financial aid or scholarships available for the classes?
We have the partnership discounts. However, if you are part of a club whose mission is to further opportunities for underrepresented minority groups in pursuing medicine, then email me because we are opening up some opportunities to encourage those specific groups.
Okay.
But there are partnership discounts through the Princeton Review. If your club currently has a partnership discount, if you are an officer, you get a great discount. And then through Doug's office as well, they've established a partnership discount.
Alrighty. What can we expect an entire process to cost, like including MCAT course application and MCAT and all that stuff? This might also be a question for Joanne as well.
I was going to say, I don't feel comfortable exactly answering the question, so I'll toss to Joanne.
Yeah, so from beginning to end, you're going to have your MCAT prep costs, whether that is just buying the books and studying on your own or buying a prep course. So there's some costs no matter what with that, unless you were fortunate enough to win a set of books or something. And then you're going to have your registration fees for the MCAT. Hopefully only one registration fee, but if you have two, that happens sometimes. And then you're going to have what are called, you're going to have your AMCAS fee. So if you are within a year of applying, I would encourage you all this January to apply for fee assistance. The fee assistance program through the AAMC actually gets you a discounted Mcat registration fee, and it gets you some discounted Mcat prep, and it also gives you up to 19 free schools on AMCAS, and most schools waive their secondary. So if you don't qualify for AMCAS or for the fee assistance program, then you have your primary application fees. If you apply to 30 schools, you know, roughly $40 a school. So you have a few hundred there. And then if you apply to 30 schools and each school costs around $100 each school, that's about $3,000 for secondaries. Normally we would have the cost of interviewing, the flights, the hotels, the suits to be dry cleaned. And so there's another few thousand if you're a very, very successful applicant and have a lot of interviews. And so obviously right now with COVID, that fee at least has been reduced. You would apply for the fee assistance program usually around January of the year before you're planning to take the MCAT. So if you haven't registered for the MCAT yet, you would apply for the fee assistance program the winter before you're going to do that. So you can look on the AAMC's website, just Google AAMC FAP, and it'll have all the dates and the process listed on their website. It'll tell you on their website what the income breakdown is per person in household, so you can know right off the bat if you're going to qualify based on your household income. And it is based on parents' income. And that will give you a good idea. A lot of our students at Davis do qualify for fee assistance, and so I would absolutely look into it. It will literally save you thousands of dollars if you do qualify. And so otherwise, if you don't qualify, I would say the whole process would be between $3,000 and $6,000. Madison, I'm going to have you check with the AAMC. My understanding is similar to med schools. When you apply to med schools, you have to list your income, your parents' income. No matter if you're 45 years old, married with 5 kids, you still have to list your parents' income to medical schools. That's how medical schools do it. I am not 100% sure if the AAMC will deviate from that. I think if they are willing to deviate from that requirement, they will indicate what are the criteria for that, whether it be you're married, you have kids, or whatnot.
Okay, thank you, Joanne. Somebody would like to see the whiteboard slide again. We're showing the scratch work for that and see how organized it is. And also, does the MCAT have testing accommodations?
I do believe they do have testing accommodations. Look at that same website that Joanne mentioned, and then read through the details there. And again, this is from the GRE, so I'm so sorry that this is a GRE type of scratch paper, but the same type of idea where you will divide up your scratch paper, you will mark through your A, your C, the questions that you are sure that you've eliminated, so that when you come back around, then you will be able to just dive back into the questions, to the answers that you need to focus on.
I'll add on the accommodation side of things. You want to make sure that if you're applying for accommodations, that you give yourself 3 to 4 months in advance of when you're going to register for the test, because that process can take a little bit of time. So you want to be thinking well in advance of taking, or of even registering for your test, whether or not you're going to need accommodations for that. Let's see, is there any other MCAT specific questions? How long are MCAT scores good for?
Typically 5 years, but Joanne, would you say that schools like to see them within 2 to 3?
I'd say on average it's about 3 years.
Okay, and then Joanne, as the Director of Admissions, is there anything that was notable when it came to rejecting applicants other than metrics?
Yeah, and so I think similar to, well, let me kind of paint a picture for you. I want you to all imagine with me that you are a physician and you are working, 50, 60 hours a week. You are all married or not. I guess it doesn't matter, but that adds another component. You have children, you have a house, you have a life, you have cars to maintain. You have a full life, right? You're trying to do all the things. And like typical pre-med fashion, you volunteered to be on this admissions committee. So now you have that extra thing that you signed up to do. So you volunteered to be on this admissions committee, and you've been hounded for a few days. You have these applications you need to review, and they're giving you 40 applications at a time. So you get off work, you're tired, your kids want your attention, your significant other's mad because you've been gone, and now you got to sit down, you got to read 40 apps. And you're probably going to pour yourself a drink and you're going to sit down, you're going to read these applications and you're tired, right? So you open up one and the first person, they did, clinical experience, they shadowed, they volunteered, they did research, they have a 3.5, they have a 510 MCAT, they're perfectly fine, everything looks great. So you're like, okay, I'll just put them on hold right now. Next person, I have a 3.49 and a 511 MCAT, and they did shadowing and volunteering and research and some community service. And you're like, okay, that person looks good too. I'll put them on hold for now. And you do this over and over and over, and every single person looks exactly the same as you open up these applications. After about 10 apps of reading the exact same thing, how is that person going to feel? Like, what's a natural human response to seeing the same thing written over and over? Your school is the type of school that's going to make me the physician I've always dreamed of becoming. Like that kind of nonsense. If they read that over and over, it just becomes like literally mind-numbing to read these apps. So then they come across someone who is genuinely authentic. They did whatever they wanted. They were the editor of the school newspaper. They were on the rugby team. They did what they had to do to show they know what medicine is about. And when they talk about why they want to be a doctor, like they're actually speaking honestly. They're being really, really clear and direct about the value that they bring to healthcare. Just naturally, that person who's reading the app is going to feel some emotional response to this change, this difference. And they're going to like the person because it's almost like compassionate to the reader to be different in this case. When you're reading thousands and thousands of applications, anyone who can create a compelling argument that they're going to make an excellent physician one day and provide evidence for that through the use of experiences, through their personal statement, directly answering the question, what is the value I bring to medicine? Not why medicine. Why medicine is the most boring question to read. Because why medicine is your journey story. It's like, well, I always knew since I was 2 years old, or I really love science, or I really love helping people. And you just kind of, everyone says the same thing over and over, rehashed in different ways. Or when my grandpa was sick, I knew that I never wanted anyone to suffer like he did. And so I want to solve all the problems. So it's sort of like, if you do what every single other person is doing, then you're going to fall through the cracks, because just human nature says that it's hard to pick people out when everyone looks exactly the same. So instead of just trying to be like, there are people who will tell you, some consultants, some influencers out there who will say, the key is just being truly unique. You just got to do the most unique things. And I'm not sure that, I think there's a difference between being truly unique and being authentic. And if you don't know what being authentic means, or if you reflect upon that and you realize your true authentic self just isn't someone who is interesting, then I would argue that you aren't ready to apply to med school. You need to do something with your life. You need to work for a couple of years. You need to gain some insight and some reflection about yourself and the world before you apply, because you can't force this to happen. You can't check off all the boxes and expect that just because you did all the right things, you're going to be appealing to the world. That's doing all the right things oftentimes is actually not the most appealing thing. It's the people who have lived a little, failed a little, who have some really keen insights into humanity and the world and medicine and all the things. And so, the thing in terms of like who gets rejected, like she showed, there are 6,000 applications and only 100 students end up matriculating. So far more people get rejected than accepted. So they don't decide who's getting rejected. Most people are getting rejected. The question is who's not getting rejected. And that's where you have to focus your energy, is how do you show them who you are as a person and why you want to do this, and that you're going to be good at this if they pick you, and that you bring something to the table that adds value to the world. That was a very long-winded answer, but I hope that helps.
All righty. Well, that was a long question too. So let's bring it back to the MCAT real quick. There's a question about, is a psychology and sociology courses required? So that can be brought up in two ways. Is it required for the MCAT? I'll throw that to Christine.
Hey, can you see me?
Yep.
Okay. Well, it's covered. There's a psych-soc section covered in the MCAT. So as long as you have these courses, I pulled up the listing here. then you have the content. You should have the content in order to do well on the MCAT.
Okay, so I'll ask the same question to Joanne. Are psychology and sociology required for med school?
Not usually. Some DO schools require psychology, and so if you're planning on applying MD and DO, you would want to take Psych 1. I usually recommend that people take Psych 1 and Psych 41, just because Psych 41 is research methods. And it was actually a few years ago, we had a representative from Princeton Review come and do a presentation, and they flew her down from Washington to do it, and we invited the chairs of the sociology department and psychology department. Everybody came to hear her presentation, and it was actually the sociology department. She was showing a lot of sample questions, or psychology department. She showed a lot of sample questions from the psych section, and it was the chair of the psych department who said that based on the content that she presented about what's on the MCAT related to psychology, that it was actually research methods, Psych 41, that would best prepare people for the MCAT. That was what the psych chair said after looking at the content. And so since that time, I've been also recommending Psych 41, just because so much of the MCAT, from what I hear, is about skills. It's about thinking, not just about memorizing. Some of it's memorizing, but Psych 41 should teach you how to look at some research results and draw some conclusions, rather than just memorizing dates and people and all of that. So I don't know if Doug or Kirsten, you'd agree or not, but that's sort of what I've always said to people.
And I agree. I didn't want to go one way or the other, but this is just the content that is covered on the exam. So I didn't want to say one way or the other because I'm not sure what is exactly covered in the courses. But these are the skills that are being tested. And one of the great things is that you have at your fingertips practice tests that you can take prior to. And we have, Joanne, I don't know if you guys have a separate practice test. I thought I heard you mention in the prior session. Do you have a practice test as well that you offer?
Yeah, so participants in this program will be able to take a full-length practice exam at the end of the program. We've been doing that for years with Princeton Review. We have a mock MCAT day, and people will get access to a free practice test.
Perfect. And one of the things, if it is through the Princeton Review, one thing that I recommend is going back into your score report afterwards, because a lot of students will take the practice test and see the score and never dive back into the questions. With the Princeton Review score report, when you dive back in, you can expand each section and you can click on each answer to see what you marked. It will even save your highlights and your strike-throughs. You can see what you marked and it will give what the correct answer is, and will then give you a short explanation as to why that answer was correct. And that will be throughout the exam. And then it can also give you a high-level overview of which concepts were tested and how you fared within those specific concepts. So you can get, you can either get that high-level overview, or you can get the detailed short explanations for each answer. So we really recommend that the students go back into the score report so that when they are ready to prep for the MCAT, then they can focus and work within their strengths and weaknesses and have really intentional prep versus, as Joanne mentioned before, you're not just checking boxes with your activities and experiences. It's how you've changed, how you've what you've learned, how you've grown. With these exercises, with these practice tests, with the drills, with the videos, you're not just doing them, you're trying to make sure that it's being maximized and optimized for you. So we're excited that at the end of this that you will have access to that practice test, and we highly recommend that you do that. And then it will open your eyes to how the questions are asked, what types of questions are asked. And maybe that Psych 41 is that better class that will prepare you better for the types of questions that are asked on the Psych Soc portion of the exam.
I'll concur with the Psych 41 being a really good prep. In fact, I think in a lot of ways it's more effective than taking, say, Soc 3, just because of the limited amount of sociology on the MCAT compared to psychology. But Psych 41, people that take it have a lot easier time getting up to speed on the Psych Soc section. So another question came in terms of med school prereqs, are anatomy classes, labs required? So I'll add a piece before I throw that to Joanne. Anatomy isn't a super important part of the MCAT, so don't worry about that for the MCAT. Worry more about physiology there. How about anatomy for prereqs for med school, Joanne?
Yeah, I don't know of any I mean, I'm sure out of the 140 med schools in the country, there might be one or two that require anatomy, but generally it is not a requirement for med school. It is a requirement for nursing and PA, but you don't really need to do that. And you know, again, it's all about strategy. If you are trying to build an upward trend and you're just trying to prove that you can take really hard science classes, then do it, but you have to get an A in it. If you take it and you get a C in it in your last year, then you've not helped yourself in any way. So you need to make sure if you're going to do that, take a really difficult course that you're in a position to be able to do really well.
Alrighty, and we have another question, just sort of verifying what you said about all in for applying MCAT, et cetera. You said around 6K for cost, Joanne?
Yeah, I mean, a normal year if you're flying and everything.
Okay. Where can I register for the MCAT review sessions at UC Davis? I think the MCAT review sessions that Christine was bringing up, those are going to be part of our MedPrep program. So every MedPrep session you come to, there's going to be a different subject covered. So just come to MedPrep and you're already going to be in those. In addition, I'll just plug my own little thing. We are going to do some extra MCAT prep sessions during the quarter. So we'll be doing that starting next week. So if you just check out hpa.ucdavis.edu/test-prep, you can find all of the test prep things that we're doing for you here on campus. Then another question for Joanne. Joanne, what was the website to check for if you are independent in regards to Madison's question? So I believe she's talking about independent for financial assistance.
Yeah, it's the AAMC's fee assistance program. I can Google it real quick and post it in just a sec. You know, almost everything, I just use Google and it's the first link that pops up. And yeah, here we go. So you can check that out. It should have a lot of information. It says it's already opened. It opened October 9th. And this would be for people taking the MCAT in 21.
Yep, and that also includes, if you qualify, all of the AMC practice materials, the online bundle for MCAT practice. Yep. Any other questions for Christine? Well, we still have her here.
Thank you so much, Christine.
Yes, it looks like we're sort of wrapping up here. Thank you, Christine, for your time. I appreciate you coming down and letting us know about a little bit about the MCAT and what Princeton Review can do to help.
Thank you so much for having me. And again, this was just an overview so you get a sense of what to expect. Those MedPrep sessions are going to be so valuable where they deep dive into the content. And then also the test prep courses, like I said, come with the books, the content review with the instructors. You can rewatch those recorded sessions. You can do the online drills. You can have the MedFlix videos, do the practice test. It's so comprehensive that if you don't improve your score by the certain amount of points that they guarantee, you do get your money back. We believe in the product that much. And please make sure to reach out to Doug for the partnership discount code, because I want to make sure that you're getting the best price available. Oops, sorry about that. Sorry about that. And I'm going to mute myself because all of a sudden we have a pack.
That happens.
The wonders of Zoom calls, aren't there?
All right, I'm going to unshare her screen too. Let me see how I can do
Any
that.
other questions for Joanne or just in general?
Well, good news is this isn't the last time you're going to see us. We're going to be around all year. So this is your space. MedPrep is your space to come together and bring all of your pre-med questions. There isn't a silly question. We are keeping this a lot more focused on application stuff. So I assume most of you here today who are getting ready to apply in the next year or two have already taken most of your prereqs. So you notice we're not spending a lot of time talking about different courses and whatnot. I'm happy to answer quick questions, but that's definitely not the purpose of that. We have orientations and whatnot for that. Doug, I'll let you answer the difference between test prep 101 and 102. I'm not sure about that. That's your area.
So the test prep 102 sessions are basically sort of introductory sessions where we're doing things like taking practice tests. So we're doing a mock test, and then also just sort of introducing what basics there are about the different tests. Specifically, I'm betting you're talking about the Mcat. Test prep 102, we take a deeper dive into the test, looking at what content is on the different sections and different strategies and approaches for tackling the sections effectively.
Very good. That's awesome. Doug's been such a huge addition to HPA. It's just, I mean, we always partner with outside, we usually partner with the Princeton Review for a lot of our support, but just to have someone who can answer questions like that and be there for you all as you navigate this on campus is so valuable. So I'm really thankful to Doug for being here with us too. I want to thank you all for coming because we couldn't do MedPrep unless you showed up. So thank you all for waking up early on a Saturday morning and hanging out with us. As I said, we are going to do so much of this, so come back with your questions. This is a safe place. You can ask anything, and we will get to the heart of how to get you all into medical school. I'm a really big believer that every single person can get into medical school from UC Davis. It's not a competition amongst you all. We are competing against the rest of the country, not even California. So we need to make sure that all of you are in a good place and good position, that you all do well. And that we can all get you into med school, whether it's in 1 year, 2 years, 3 years, 5 years, it doesn't matter how long. It's not a race, but we need to make sure that you're all good and okay, and you do well in your courses, and you do well in the Mcat, and you feel good, and you know how to do this. So I'm really happy you're here. The calendar is on our website. We have, Doug posted it, so you can check out our Facebook page. Like I said, the Facebook page is nice because we have the events and you can get reminders, and we also post throughout the month in between sessions. We are going to post the recording on our website and on the Facebook page. All right, well, I want you all to have a lovely Saturday, and we will see you on November 7th.
Thank you, Christine. Thank you, Joanne. And thank you to everybody for coming on down.
Thank you so much. Have a good rest of the day, everybody. Thanks, Joanne. Thanks, Doug.
Yep. Bye.
Bye.